A busy schedule this evening. Health and safety are here, health and welfare, public safety, and hopefully by 8:30 we'll hear a presentation on cultures and recreation. So if everybody take their seats, we'll start the meeting with a Pledge of Allegiance. All right, I would just, I beg your pardon? I'm not going to have a moment on the side. I would ask everyone in the panel, when asking a question, speak in the microphone. First up this evening is health and welfare, and I saw Sans Cleary in the audience. I believe he will be presenting. So, Sans, step up the mic and take it away.
Thank you very much. Sans Cleary, Director of the Fairfield Health Department. Our budget this year, the bulk of the increase in our budget, other than the contractual agreements for salary, the entirety of the increase that we've requested is related to three part-time positions that we've requested. They are we requested 2 health aides and 1 part-time nurse. To explain the reasoning why, I have a short overview of why. Essentially, there was we've been feeling some pressure at the high school and middle school levels, and these positions are targeted at those levels. At the middle school and high school levels, we've been feeling pressures within the nursing office in terms of completing and doing all the tasks necessary in those offices. So some of the things that have been affecting those, there's been 2 legislative changes in the past few years. There's been some increase in the demands for service and some expectation of that increase will continue based upon census. There was a few years back the high school clerical staff was reduced, positions were eliminated, and that had a resulting reduction in clerical support for the nursing office. And the 4th reason that I'll go into a little bit more detail in a moment is that when we look at our numbers, the National Association of School Nursing produces ratios of what numbers you should be at, and we're currently operating below that industry standard. So to go back into that, the legislative changes that we experienced, there's two new laws in the last few years about it's changes in the 504 plans for kids and changes in what's called the homebound legislation for when kids need to be educated in their home setting. There's some increased demands that are placed that come down to the nursing office. For example, more children now qualify in the school system for these 504 plans, and a component of the 504 plan is essentially, a plan developed by the nurse, a series of meetings and a series of training after that to ensure that that plan for that child is adequate. And so with more students qualifying for that type of plan, we're seeing that, there's pre-meetings taking place. It takes the nurse out of the office so that episodic care that's going on is impacted. And generally, when you go to these meetings, there's a plan developed. The plan is adjusted and talked about and tweaked, and then the nurse has to go down and finalize the plan. And then as a result of that, the care plan is developed. There has to be an emergency plan based upon that care plan. They have to conduct emergency drills based upon that care plan. The nurse has to conduct teacher training, and anytime that student goes on a field trip, there has to be accommodations made for that field trip. So more kids qualifying for these types of plans causes more work going on in the office. There's also, with the 504, with the homebound legislation, it's another issue where any child that is being educated in the home or is being requested for that. The nurse, there's a role for the nurse in having a dialogue with the physician and understanding the reasonings behind that decision, and it inevitably results in several more questions going back and forth and working that into the plans developed. So essentially, we've also been seeing, the second point is that at the middle school and high school levels, if you combine the numbers there, we're seeing increases across the board in just things like the basic episodic care student visits is up about 5%. And these numbers are year over year, the last full school year and the previous school year. The medications administered by the nurse, we do over 18,000 medication administrations in the schools per year, is up 41% during that time period. And then these team meetings, now we add 504s and the PPTs and the other meetings discussing and planning for these types of meetings has also increased. The number of team meetings or meetings that the nurse has to participate in to effectively care for those children has gone up 47%, and that's attributable to several factors, including the 504 legislation changes. Also, when we look at the increase in the census for K through 5, we're also seeing increases in the census there, so we feel that this trend is not likely to level off or change in the near future, that we expect this gradual increase that we've been experiencing, or this significant increase that we've been experiencing, to continue. Regarding the clerical support, historically, several years ago, the standard had been the school would provide the nurse 20 hours of clerical support per year. So the nurses operate independently. They don't have secretaries or anybody else in their office. They essentially do all their own clerical work, but with the exception of that, typically in the beginning of the school year, they have some assistance in doing things like helping with the input the physicals and the sports schedules and arranging all that and ensuring that everybody has all the plans and everything necessary. Due to those reductions in the actual number of clerical staff that the high school has, resulted in a reduction of the hours. So now we get 10 hours per school of clerical support per year. So and again, that's not the sole reason, but it's a component of that. And then also, and lastly, based upon the National Association of School Nursing, they have standards that they say, based upon your census in the school, children of this type of medical condition, the overall number of students, they come up with ratios of how many nurses that you should have given that school. And so right now, based upon our current demographic, in the schools, we should have a total of, at the middle school and high school level, according to the National Association of School Nurses, 11.9 nurses. Currently, we have 8.9, so we're at about 75% of the industry standard. And so when we started getting to that kind of deficit, we start getting concerned about potential liability. If something was to go wrong, it opens up the door to punitive damages in terms of our potential liability. We're operating below the industry standard, and our proposal tonight, the positions that we requested, with the understanding that one of these has been reduced by the Board of Finance, but our initial proposal was for 2 health aides. I had asked my nursing supervisor to look at this situation and come with a solution that was the most cost-effective for the town. And what we requested initially was 2 health aides, which is basically a layperson with first aid training and some clerical skills that would help at the high school levels relieve some of those pressures felt by the nurses there, and that would allow them to some relief of the episodic care. If you've ever been in the school nurse's office, there's kids coming in constantly, in and out, and that interrupts the ability to do this planning that is required and to effectively deal with the increase in this planning. So we had requested 2 health aides, part-time. One would be located at each high school, and then at the middle school level, we requested a part-time nurse, and that would help bring the hours up closer to what is expected by the industry standard, but it doesn't get us all the way there. Our request is essentially 3 part-time positions at the most affordable level. We feel, the 2 health aides and the 1 part-time nurse, and that gets us about half of the way of the gap that we currently have. So we're not requesting 3 full-time nurses. We came with 3 part-time positions, only one of which is a part-time nurse, to get us about 87.5% of the industry standard, just to close that gap a little bit. And so that is the reasoning behind our request.
Questions? Dave, please speak in the mic.
Stan?
Sands, like the hotel.
Sands, okay. David McKenzie, District 3. You gave us some metrics for middle and high school. If you were to look at overall, how does the metric look versus the standard for Fairfield, and how does that compare to other schools in DRGP?
Well, essentially, we are, in some cases, a little bit better in some areas and a little bit worse in other areas. And so in terms of our staffing levels, you're talking, how do we compare to other towns in terms of our nursing ratios? Like I said, some districts in some levels we're doing better, and our nursing supervisor, Joanne Ryan, who's here, has done some of that work. But essentially, the summary of it is that some areas we're better. We talk to different towns, and they may have 3 nurses in the high school level at the same student population where we have 2. At the middle school level, we might have 1.6 nurses where they have 1.2. And so there's no perfect mix in terms of how we directly compare to somebody. But in a sense, we look at the industry standard and what should we be at, and that's part of the reason why we're bringing this request forward.
All right. Thank you.
Thank you.
Yes, you.
Hi, Ellen Jacob, District 9. Is this pointed the right way? I guess this is a general question, and you're the first one I can really ask it of. I am hearing, on our end, we're hearing so many requests for special ed, for medical, and then the medical, mental health, all aspects. Do we have some kind of epidemic? I mean, is there some change in the makeup of students or the conditions or the times we live in? Because it seems every moment I look at every other budget line seems to have some connection to it. So that's just a general question.
Okay. In terms of epidemics, no. We don't have any current epidemics going on in the area. But there are changes in the nature of how things are cared for and how things are addressed. For example, and just to use a general example, the way concussions are dealt with nowadays is significantly different with how they were dealt with even 5 years ago in sporting. And so that has an impact on school nursing as well, in terms of the post-concussion, return to school, those types of questions with the doctor, that type of plan that needs to be developed and assessed and monitored. So it's a change in the nature. Things are changing the way we deal with things now. And so that's one example, and Joanne could probably give you 10 more of how the way we've dealt with things has changed, and that basically increases the workloads for some people within the system.
So the 5% rise in the 504 participants, how many does that actually, how many students are you
The
talking?
5% increase that we're talking about is increase in the number of visits. That's episodic care from injuries and illness coming into the school nursing office. It's not a 5% increase in 504s. I don't have the numbers for how many more 504s. We do know that we're participating in hundreds of more meetings per calendar year per school, in trying to address these needs. I should say hundreds of more meetings over the middle school and high school level.
And can you speak in general terms? Are they more sports related than anything else?
I think it would be fair to say it crosses the spectrum of all issues, all health-related issues that we're seeing. It's not. I wouldn't put that increase in visits that we're talking about on any one particular issue. I think it's just we're seeing a general increase in kids showing up to the different nursing offices at those levels.
And the 41% in medication.
41% in medication administration. Some of that ties into the changes in the way medications are administered nowadays. There were, just to use one example with ADHD, there was medications given once a day, and there's been somewhat of a change to now where that medication, it had been this way in the past where they would take medication in the middle of the day, then it went to one a day, and now it's going back towards the other way where the students would take one during the day. And so that has an effect on us in terms of, it's, when the student comes in for any kind of medication, it has to be monitored, recorded, observed. In some cases, medications have to be tracked in terms of the quantities remaining and all that type of detail that needs to go into that. So it's a detail-oriented type of role there with the medication administration.
Okay, so in this case, too, it sounds like, am I wrong in assuming from what you're saying that it's not necessarily more students on medications, but more frequent dosages, or is it a combination? Are there more students on medications?
Do you want to come up? Joanne Ryan, our nursing supervisor, I thought she would answer that
Thank
better than
you.
I.
Yeah, I think it's more students specifically that are on medication. And, there's a lot more kids on EpiPens, inhalers, and even at the high school level, nurses are monitoring those kinds of medications.
Thank you.
I have a question. Sands, you mentioned you expect this trend to continue. What is the basis for that?
Well, just as I alluded to, that in looking at the census K through 5, there is a general increase in the number of students that are coming up through the system.
Okay, so
That was the basis for that. That we don't see this as a peak that's going to go back down. We think this is going to be a trend of gradually increasing.
So there's a higher incidence already in the lower grades, is what you're saying?
I think we were just looking at numbers across the board. The census is going to be maintained, not necessarily related to the medical issues, although I could probably make a correlation there if I had to as well. But we looked more at the census. So in other words, the census is not decreasing. It's not as if the student population has peaked and is going down. So over the next 5 or 6 years.
Okay, but there's a higher incidence of illness indicated by that census, is what I'm hearing.
We're seeing more, in those 3 areas that impact the nurses, we're seeing more visits, more team meetings being required, more medication administration.
Okay. All right.
We don't see that decreasing as more students come up through the system.
All right.
I mean, if we say the ratio is going to be maintained, I mean, we can't be assured of that, but the numbers are going to be the same or increasing. So, the assumption is that we're not going to get any less busy than we are with medical issues and meeting student needs.
So in other words, what I'm hearing is it's not a bubble right now. So.
Right, doesn't appear to be.
All right. Let me ask you this. You referenced, you referred to them as part-time nurses. What does that mean in terms of number of hours and benefits?
There are no benefits associated. It's 2 health aides, so it's only one nurse is actually being, a part-time nurse is being requested here. So it's essentially, well, the RTM reduced one of the health aides. So we're here before you, the Board of Finance, excuse me, reduced one of the health aides. So the original request was 2 health aides, 1 part-time nurse, all part-time positions, no benefits. The current proposal right now is for 1 health aide and 1 part-time nurse.
And in terms of number of hours per week?
19.5 hours per week.
Per
Position.
Okay. Yes.
Hi, Sands. Liz Ezema, District 6. My mom was a school nurse, so I know the important work they do. On the drills and the training, is that standard protocol, or is that changed in response to some of these demographic changes?
Yes, well, emergency drills are actually required for students with food allergies, students who have EpiPen. So, those drills have to be conducted, twice a year. Emergency plans for students with diabetes, for students with seizure disorders, they have different kinds of emergency plans. The law doesn't say that they have to be drilled, but you know, we have general emergency drills. The drills we do for food allergy students, we could, you know, also apply to another medical emergency. As far as teacher training, that's across the board. You know, anyone with a care plan, teachers are trained to care plans, and then students with medication, teachers are trained to medication plans as well, especially when students are going on field trips. They have to be trained individually, all that has to be documented, and, you know, there's quite a lot of legislation. The medication regulation is pretty onerous in terms of how we document things and how we carry out that task. It's important because for the nurse, medication to a teacher is a delegation. And so, you know, it's under her license. So there are certain ways that that has to happen.
Thank you.
Thanks. John Donovan. Sands, you mentioned the ratio of students to nurses and the recommended ratio. What do we have and what's the recommended ratio?
Currently, we have 8.9 school nurses at the middle school and high school level.
I get it from a school standpoint. I mean, how many students per nurse? I would assume that's the way the ratio would work, not per school?
It depends on the acuity of the individual child. So if children with certain conditions will change the ratio. So it's not a straight, you know, one nurse per 400 students type of thing.
Okay, so then what would the recommended ratio be per school versus what we have?
As a whole, I can go individual school, but as a whole, it's 11.9 is what is the National Association of School Nurses recommendation for us, given the acuity of the students that we currently have in our census.
So that's something you report to them in terms of acuity, I guess, is incidence of allergy, incidence of special needs, incidence of anything else?
Yeah.
And that comes up with a ratio that they come back to us with?
Yes, there's a recommendation that this is the level, it's an association of school nurses recommendation that we feel that the school nursing, the level of nurses should be at this level. We're currently three positions below that, or at about 75% of the industry standard.
Okay, do you know what where do most other schools fall statewide? I know, as an example, for guidance counselors, we're at we're at double what the ratio is. Sorry, we're about 50% better than what they recommend, and we're about 4 times lower than what the state is. How do we sit on this versus what the state average might be?
Well, I really can't speak to the whole state average, but in canvassing the towns that are in our, district, my nurse supervisors group, again, in some cases, we're not as well-staffed, and in some cases, we're better staffed. So depending on, the town. I can't speak statewide.
And then you were just saying the incidence of like allergies. I have 2 allergy children. It just seems like it's more and more prevalent. But you're saying you're not seeing that in the schools. You're not seeing a higher incidence. You're seeing more students, which brings along, more people with certain needs. But you're not seeing a higher incidence of anything with each new class. That's what I heard you say. I just want to make sure I heard it correctly.
Oh, no. I think what I said was when we talked about the when we talked about the numbers being stable or rising, we were talking strictly about the census. Am I seeing an increase in incidence? I really have not looked at that in terms of, if we have more food allergy kids in grades 1 to 3 that are going to be coming into the middle school. Overall, I think that things have just been becoming more complex. I don't know a better way to say that. It's kind of hard to quantify, in some sense, the amount of time per student, depending on their medical diagnosis.
Yep. And one last question. I was looking through just in terms of what's the total budget from an expense standpoint, and then what is it from a revenue standpoint? Because I see there's revenue in there in terms of like inspecting restaurants and other things. I'm just trying to get that in my head in terms of what that looks like.
Our overall budget is just under $3 million. Our revenue, I can, off the top of my head, I think we are fees and revenues in the area of $150,000 to $200,000.
And and that's driven mostly, it looked like it was driven mostly by inspections.
Yeah, well, the licensures for, various facilities that we license from.
And what does that entail? So you have health inspectors that go in and inspect the restaurant or inspect the store to make sure they meet different standards?
That's correct, yeah.
Okay, I'm new, so I'm just trying to
Yep, no,
figure
we've
this stuff
got
out.
restaurants, food stores, hotels, motels, rooming houses, public pools. We've got beauty, barber, nail salons, a variety of different entities that we inspect, all the seasonal concessions, vending trucks, temporary food events, farmers markets. Those are all people that are issued licenses, and every license, the intent of a license is that we know about who you are, and we review the foods that you're selling and serving, and that we inspect you on a regular basis to ensure you're doing it in a safe manner.
And how many inspectors do you have to do that?
We have 4 registered sanitarians that conduct those inspections.
Thank you.
I'm going to try to keep us on schedule here, and I think we have time for a couple more questions. I know Sheila had one question.
Thank you. Sheila Marmion, District 6. So I walked in a little late, so you might have covered this. But in terms of what the Board of Finance did in terms of eliminating the one health aid, you mentioned a potential risk of liability the town faces. Are we facing that with the elimination of this health aid, or are we missing the state mandate? Is it both, one, the other?
Well, we've been feeling this pressure for some time at the middle school and high school levels. We've been, as many departments within the town have been sort of manning up and trying to survive with what we have for several years. At this point, we felt like it's at a point where we feel we need to at least bring the request before put it in the budget and at least ask for these positions. We're feeling that it's time to at least ask. The impact of that reduction, we came up Joanne came up and met with all the middle school and high school nurses and developed a plan that they felt would be best to meet the needs that they have, and this is what they brought forward. The reduction of the one position will adjust that plan. The health aid that was reduced will now have to be shared between 2 high schools, so essentially you're getting half of the clerical and episodic care support that we had intended, but we understand it's another tight budget year, and when things have to be reduced, we understand that. It'll adjust our plan.
Thank you for that. But I guess my question is the town at risk in any way of somebody saying you're not meeting what you're supposed to be meeting? Are we liable in any way by not having this aid or with further reductions?
Well, again, there's always liabilities in any department. Right now, we're bringing this request forward not based solely upon liability. It's based upon the 4 points that I had discussed there. It's one component of it that brings concern to us because, if something were to happen and we're understaffed, according to an industry standard, that's typically the first thing that anybody will look at is what's the industry standard. If there are no regulations specifying it has to be this way, they look to the industry standard and say, are you short of that? And so that opens a door. But again, we are always experiencing liabilities in the town.
We're already into fire time. If you any other? Joe? Ray?
Joe Palmer, District 4. So I can only imagine the amount of paperwork that each one of your nurses has to do, but I was hoping you could take us through how that process works. Is this something where technology is used? Is it all paperwork? Do you have to store it? Or, can you maybe just walk us through that?
I'll let Joanne go into it, but I'd say yes, all of the above. We've always had electronic medical records. We've recently switched over to the Infinite Campus that the school system acquired, and we will continue with that. But it's a lot of. Joanne can provide you with the numerous examples of everything that we have to track and keep records of and store, and I'll let her share some of that. An example of walking you through some of that.
Okay, yeah, that'd be great.
Well, just for example, all the mandated physicals, which happen in kindergarten, 6th and 10th grade, all the sports physicals, all those have to be entered, all of them have to be reviewed by the nurse because she's looking to see if there are any medical issues that the doctor has noted. Then that has to be entered. All state mandated immunizations have to be entered into a database. All the students' conditions have to be entered because that's how teachers are made aware of medical conditions of students. So there is a lot of data entry. All the mandated screenings have to be entered. Every student that comes into a nurse's office, you have to document on that student the visit, what happened, your interventions, your discussions with doctors, your discussions with parents, your discussions with teachers. All those are entered into the database. And then plus there's all the paper that comes with that has to be filed. In addition, if anyone has an activity restriction, if anyone has a special doctor's order, medication order, all that has to get entered into the computer.
Right, and thank you for that overview. Sands, you had mentioned the 20 hours of clerical work. Maybe who's doing all this clerical work? Is it each individual nurse doing
Yes.
it?
The nurses are essentially doing, they each, at the middle school and high school level, they each have 10 hours of clerical support, which is typically used for the year, which is typically used, in the beginning of the year to help them with all that influx of paperwork that comes in last minute,
And that's someone else in the department that, let's say, is taking their time, or you're bringing in outside?
Clerical support from the Board of Education or the Fairfield Public School System provides 10 hours of clerical support for each nurse per year.
Okay.
And so with the health aid positions would help with some of that in terms of all this data entry that needs to go on. They can assist with some of that data entry as well as taking some of the relief off of the episodic care where it falls within the line of first aid.
Okay, and how did I'm not sure if I followed how the 20 hours went down to 10 hours.
A few years back, just with the budget cuts that all departments throughout the town have been experiencing, one of the cutbacks at that level, at the secondary school level, is a reduction in clerical staff.
Okay, it's a Board of Education reduction that occurred over the last few years.
Yes,
Okay.
several years back, there was a reduction in actual staff within the offices within the secondary schools, and that had an impact on us. Yeah.
Okay, and actually, that's it. Thank you.
Okay.
Last question.
Hi, Ray Newberger, District 10. I'm just curious, I think the 41% increase in medication could be rather alarming. Could you say what percentage is psychiatric, and if you guys foresee any programs in the future that might help to facilitate or commingle, possibly in the future that we might need more administrative or clerical assistance going forward?
I'm sorry, what was the last part?
I was just curious of what percentage is psychiatric, like ADHD, or as opposed to what's, for allergies or diabetes or.
Right.
Data.
And do you foresee that in the future we might be having a meeting where we need more clerical work to administer maybe special services going forward?
Right. I do not have that number. I'm sorry. Just from an anecdotal standpoint, I'm hearing that there is quite an increase in psychiatric medication. But I do not have the numbers, so I wouldn't want to really comment on that.
We're waiting. Short question?
I have no idea. Gaylord Meyer, District 1. Could you help me understand, are there overlaps between the work that the Board of Ed has in their staff as well as with yours?
Well, there are some overlaps in the sense that the nurse is a part of the team that collaborates on any student with any kind of need. So the nurse will participate in guidance meetings, in preparatory 504 planning meetings and PPTs to ensure that a child with any kind of medical issue is properly cared for. So there's overlaps in that in terms of the nurse is a part of the school's team in addressing any child with a health need. But aside from that and the clerical support, essentially the nurse takes care of all the health services in the school related to episodic care, medication administration, planning. They have contact with numerous people within the school, especially at the high school and middle school level, secondary school level, with the coaches and the athletic directors and those who are planning field trips. So they are integrated, but essentially they have clear responsibilities in terms of medication administration, planning, episodic care.
So what I'm hearing you say is that they work together, but they have separate duties.
Correct.
Last question.
All right, I'll make
I've
it
been
work.
hearing this for some time.
Right.
Well, if we had any idea you were going to be this fascinating, we would have allotted more time.
All right, I'll make it quick. Laura Devlin, thank you. And I can appreciate all the complexity that you've talked about. I thought that you had mentioned when Representative Donovan was talking to you that in certain areas there might be some maybe overstaffing, or you might be higher. Other areas, certainly like you're describing in middle and high school, potentially lower. Is there opportunity to redeploy the current workforce into other areas?
When we were talking about higher than other schools, neighboring schools. And so, in terms of how we are staffed now, I mean, there's always adjustments going on. Joanna's constantly sort of adjusting based upon need. If a large screening is going on in one school, there will be some shifting. To address this, and what we've been feeling over the last few years is to address this particular need at the middle school, high school levels. We have been trying to make adjustments and try to see if there's efficiencies to be made, both data efficiencies, clerical efficiencies, and staffing efficiencies, and we've been achieving that. But we feel like there's a pull from other areas where work needs to go on to help with this middle school and high school level pressure or stress that's been going on in the system. And so those adjustments, we've tried to do that, but we feel like it's at this point, it's patching it and we're getting by, but I think there's a better solution, and that's what we brought forward tonight. It's what we hope is a better solution to relieve some of the pressures there.
Sands, Joanne, thank you so much.
Thank you. Thank you.
Okay, next up, I believe, is Fire. Chief Felders, or not? Ah. Evening, Chief.
I think it was Health and Human Services, wasn't it?
Open for questions.
But I believe that the senior center was up next. And when we finish asking questions of the members of the body, could we just make sure that nobody in the public has any comments? Thanks. Pardon me, Mr. Chairman, can we take a 5-minute recess to get more tables?
Almost. In the interest of keeping on schedule, we're about to resume. Carrie Geekencat?
Thank you.
I got it right.
Perfect.
All right. I apologize for setting the chief out of order, but you got kind of mixed in with the rest of health, and I apologize for that. So if you would talk to us about the senior center.
Yep. Good evening, RTM and moderator. Thank you very much for this opportunity to speak with you. We were very happy to have everyone come, as many could, to our open house on March 15th. So I know I got to meet many of you then, and I look forward to working with you this year. The Senior Center is changing. The Senior Center is reinventing itself. We are definitely a growing population. The 65 plus will be continuing to grow in the demographics. Certainly Fairfield is no exception to the rest of Connecticut, where that population group is expected to accelerate and increase. The reason I am before you, though, is because in growing, we are changing our schedules, we are adding programs, we are doing things that people would like to see in a senior center that is more reflective of a younger senior, but we still have another age group, those that are in their 70s and 80s and 90s, and even we have a 106-year-old. So we have two distinct groups. It is one part of the Department of Human Services, a very important part, and it is a privilege to work there. The other part is the Social Services Department that I am responsible for, with 4 part-time social workers. These social workers are dedicated professionals. They are seeing increasing complex cases, with not in regards to only to seniors, but seniors and their adult children living with them. We get referrals from the police, fire, school, health department, and we do follow through and make home visits, as well as explore all the resources to family members that call us for information. So that keeps us pretty busy, and I supervise those social workers on an as-needed basis during the day. The third area is the senior bus transportation. They have about an active core of about 250 seniors throughout the year that rely on those services, so that's an unduplicated count. These seniors come to the senior center, they come for lunch, they come for programs. They also come for exercise classes, for intellectual and other classes. They come from our senior housing areas in Fairfield, but they also come from regular homes, Greenfield Hill, Black Rock Turnpike, throughout the entire town. This area that I'd like to talk about next is an area that you brought up, actually, at our open house, which is the Long-Range Strategical Planning Committee that has just been developed, with 4 members and myself looking ahead for the next 3 to 4 months and working very hard to map out exactly, after I've been here a year now, exactly where we want to go and how we want to grow and direct the growth and how we can serve the community of Fairfield. That group will really be my core group to help me understand where we are headed, and it will help me form the goals that I'll be submitting to the first selectman, 1st of July. So out of that group, we will be looking at reorganizing and job descriptions and trying to see where we can most serve, do the most good. As you know, the Board of Selectmen, Board of Finance did approve a part-time position for a senior center director, and we are thrilled and hoping that you will also concur with their belief and their vote for us. This will actually help us to extend our hours, which we've already done this year, but at a cost to the staff. That means that we will continue our Saturday morning programs, and we will also have Wednesday evening programs. This allows people to get an introduction to the senior center, to see what we're about. It's no longer the drop-in center where people used to come and stay all day and just kind of hang out. That is not what the senior centers of today are looking like or becoming. They are places where people come for resources and information. They're places that they call, they email, they want to know how to get information and get it quickly. So that is really what we're seeing. We see people come in for a class, we see people come in for a program, and then they leave and go home. So their socialization is limited, but they have many other options. So we feel as though it's important to have good programming so that they know to come back when they do need those more serious issues addressed. Serious issues such as aging in place, and having home care services, or being able to stay and afford to live in your hometown. So these are all issues that, you know, don't seem right in front of your face when you're in your 60s, but as you become maybe retired and in your 70s and 80s, they definitely do become more important. So I wanted to turn it over to you and see if you had any questions for me, and I'd be happy to answer them.
Hi, David McKenzie. You gave a very nice tour.
Thank you.
I forget, though, what is the town participation in the senior center? How many seniors participate?
We have 1,300 that are registered, and we just started this registration process last spring. And then in this past fall, we issued out FOBs, which are the magnetic strip, the barcodes. So in the fall, people got their FOBs and have started registering. So from that data, which is about 6 months old now, we have about a core of 600 people unduplicated that are using the facility.
Okay. And to what extent do you rely on volunteers?
The volunteers are the backbone of the entire operation. We have volunteers with highly technical skills that are installing software to do this client database so we can track the programs and the interest. We have volunteers that are doing things much more like manning a reception desk, answering calls, and things like that. But right now, what I'm seeing being new is that we have truly got the foundation of what we run on are volunteers. And I'm happy to say we just had a new volunteer offer to be a coordinator of volunteers, because without them, if I lose those volunteers, I'm really sunk. So I'm very happy to have her help, because training and retaining and keeping volunteers is a big job and a responsibility. So I think we're in good shape.
Okay, thank you.
Terry, you mentioned your new assistant will be a part-time.
Yes,
How many hours would that be?
19.5.
Okay. That's a recurring theme. Any other questions?
Yeah. Hi, Joe Palmer, District 4. So just in terms of just to get an understanding of the kind of organizational structure at the senior center, you mentioned volunteers, and sometimes with nonprofits and such, they're volunteers, but you might not have them. People might not be committed to a certain set of hours. How many volunteers are committed to certain hours, and compared to the paid employees you have?
We have two types of volunteers. One who will do something, whenever you ask for it, and, they're steady, right there, always available. And they would tend to be seniors that have been there the longest. We have some who will come in and will want to do a fundraising event. They'll want to do a one-shot deal, or they want to give a class, or do something at once a shot. I'd say right now we had our first volunteer meeting, which had 30 new interested people. About half of them were regulars that were on, they will help out at lunchtime, they will help out with programs, they'll help fold chairs or do something. Half of them were brand new.
Okay, so, but they typically don't have, like, let's say, a certain set of hours. It's kind of an ad hoc thing.
No, we're just getting them, they're getting their schedules so that it's no longer just ad hoc.
Okay.
So we have people signed up for half a day to man the receptionist desk, half a day in the afternoon. Even though that's our quieter time in the afternoon, it definitely is a time when people come in that are new and are looking for perhaps a tour or for some information. So it's still an important time to have that volunteer at the reception desk.
Right. Okay, thank you. And then I was just curious to see the amount of fundraising that, let's say, you've been doing in the past, and what your vision for fundraising is, and how that will be a part of the whole financial picture of the senior center.
Yeah, we definitely have a plan that we are going to be doing more fundraising. We have a Fairfield Senior Citizens Association, which is a 501c3, and that group is in transition. In the past, before I came, I think they were much more advisory. Now they are transitioning themselves with a review of their bylaws to become much more fundraising for the senior center. We are hoping to have a Spring 15 gala fundraising event, so we have a year to work towards that. In addition to looking at the Commission for Human Services is also going to be looking with me at raising revenue and looking at possible the membership fee, which we would keep very modest, maybe just $10 a year. And for those who could not afford it, we certainly would understand and we would make allowances. But we need to have some of that going on. The grant writing and the fundraising is probably an area that I haven't been able to concentrate that much on this year, which I need to do more of.
Well, thank you. That's great.
Sheila?
Thanks, Joe, for raising some of those points. I was curious about your plans for fundraising and grant development, et cetera. I'm wondering if you do charge that $10 fee, will the revenue that you raise go back to the senior center, or does it go into the town's operating budget?
My understanding is it does. It goes into the town accounts, of course, but it would be designated for the senior center.
Okay, so part of the long-term plan that you're putting together with your committee will kind of outline the programming that you're hoping to fund through this
Yes,
fundraising?
exactly.
Okay.
Along with that is that we have more of a selection of programs that are charging, so that the instructor comes in and charges, say, $5 for an exercise class per person, and then 10% of that comes back to the senior center. More and more of those activities where there is an initiative on the instructor, and then we would get a return for that.
Okay, are you currently writing grants, or do you share? I know the town has some, like half a person who does some grant writing. Is there any of that sharing going on in terms of writing grants? Or are you currently writing and, applying for any grants?
I think some of the grants that have been done, while we've had certainly some of the Red Cross grants with Storm Sandy, other people have been helping out to make some of those grants available to Fairfield storm-affected areas. In terms of programs, what we've generally done is done individual appeals to banks and to different individuals to either donate part of their the cost of a program, or to at least help us in some way. So I think we're looking always at the best economy way to do something.
Okay, and one last question. The part-time senior director, can you give us a job description of what you envision that person helping the center with? And also, is it enough for you at this point?
Well, I'll start at the end and say, yes, I'm thrilled and very grateful. I think we need to build this is a whole new area for me too, so I'm looking and learning as I go. Primarily, the idea will be to offer the extended hours so we can continue to grow as a senior center. We are growing with about 20 new members a week at this point, so that's a lot. And it is the younger senior who is coming, more so than the older senior. My idea is to have the new part-time person do more of the operations and do some of the help with the database, which is tracking it and keeping us informed as to what the new database is going to tell us are programs that are profitable and so forth. I do have a program coordinator. She will continue to expand and extend the programs. Another duty I would like to have the new person do is to be responsible for more of the different day trips. We would like to expand into trips and travel. We know that's an appeal to a lot of seniors, and so we're just really branching into that, so I'd like them to take responsibility for that. But that and the daily operations will definitely free me up to do some of the things that I want to do for the fundraising.
Mike.
Michael Hurley, District 1. Just a question. I'm looking at the budget book on 266 and 267. What is the aggregate total of the proposed budget for the senior center for the coming fiscal year?
You want to break out from the department, is that what you're asking for?
I want everything aggregated into one total number.
What I have here is $554,598, and that would include the part-time position. That was the information I just received from the finance department.
Okay, so if you have 600 active users, if you take $554,598 divided by 600, that's a cost of $924.33 per active user. I know you did some field work this past year. Do you have any sense as to how that cost stacks up to other senior centers in Fairfield County?
I'm sorry, some field work?
I think you did some surveying and you spoke to other senior centers in
Yes.
Fairfield County.
Yes.
Do you have any data on how the cost per user at our senior center stacks up to those?
Yes, and let me just go back. The department, the budget for the department would include also the social services department. So the senior center is part of the department, it's not the whole thing. Does that make sense? As well as the senior bus transportation. So there's 3 areas of operations, not just the senior center.
Okay, so if you took out the counseling component,
Okay?
what would the number then be?
You know, I have the 4 part-time social workers, and I can certainly give you that. Well, it's, they're all paid about $27 an hour. So, I mean, I'd have to do the math. I don't have that in front of me.
Okay.
But, you know, those are the 4 part-time positions for the social services, and then there's a part-time secretary for them. So that, I could take that out.
Okay, if you could just maybe get back,
Sure.
I'll submit the question through the moderator, but if you could just back those numbers out and provide a total aggregate budget for the proposed coming fiscal year for the items specifically related to Fairfield seniors, including the transportation,
Okay.
that would be very helpful.
Okay, will do.
And if you have any, data comparing that to other senior centers in lower Fairfield County, that would be great.
Okay, I will send that to you.
Thank you.
Pam?
Thank you, Pam Iacono, District 9. And thank you so much for the tour that you held. I found that incredibly useful and was actually surprised about how little we invest in our seniors in terms of money in the center based on the presentation that we saw there. So I'm very pleased that a part-time director is hopefully moving forward and that this body will approve it. My question has to do with your fees and services line. What does that entail exactly? And if you don't know now, if you could just get us a breakout of what types of things are
Sure.
incurred there.
That includes the salaries for our fitness instructors. So we have those in there. We also have some secretarial services for the Human Services Commission, minutes and meetings that they take. We include in that a minimum wage worker who mans the coffee shop, who is a person who works at Bridge House. So it's a job transition opportunity for that person. So they have a small job and they just help with the coffee and the serving every morning. So that's a small area that we pay for them out of that fee. And then there is the senior center software maintenance and support, which is $1,500. That's new. So that's part of our data collection that we have to have for the upgrades. And then I added into it $500, which I was advised to help us to have constant contact, which will allow us to communicate with our seniors by email, because we don't at this point have that capability.
Okay. Would you be so kind as to put that all in writing and just submit it to the moderator so we could just
Sure.
see
Break
that
it down.
all broken out?
Yep.
Yes. Thank you very much.
Jason?
Oh, I got to read. I'll come back to these in 2 seconds. Sorry.
Heather Dean, District 4. Recently, you had a town-wide invite for a model railroad, a train show. And my husband was instrumental, along with Bruce Carter, in helping organize that. And this was we call it Generation Stop. I know how it benefited the train club, having found a new home. I apologize for asking you without being prepared for this, but could you give us your perspective on how it benefited the Senior Center to open up
Absolutely.
and have the town invited in on such a neat event?
It was a wonderful opportunity, first of all, because I think the intergenerational appeal to have something fun to do with a younger person, as well as either a grandparent or a parent, an activity to go to, and to go to a senior center where it's life, it's a fun place. It is not supposed to be a dreary place. It's supposed to be a happy and a fun place. So I think that was a great opportunity when Bruce mentioned it. The fundraising probably was secondary to the overall exposure of the senior center as a viable, lively, really wonderful place. So I was thrilled just driving around and seeing our address on all of the posters that were on the curb. I just thought that was great. People do, want to know where it is and what is it. So that really achieved that for us. It got us a little bit on the map. So that was great. Thank you.
Thank you. Thank you for that.
Representative Lee?
Hi, Jason Lee, District 8. Just a quick question, we segue to that. Do you see a lot of participations from merchants and stuff when you need donations or supplies? Are they willing to open up their doors to say, sure, no, we can help you out doing this, or are you finding difficulty just working with people within town to help you out?
I've had a great experience this past year working with the town and with, in general, not only the business community, but also many of the schools, many of the different volunteer groups, the different civic and community groups. I think in general, when I started asking for more financial support, I understood that the small business owner has their own needs as well. So nothing is going to be necessarily just for seniors, that it's not, they're not a impoverished group, you know, they're a good group, but they have a fixed income, but they're not necessarily the poor, pathetic seniors. They're just regular people, so they want to know that they can get some return too. So I've had a good experience, but I've certainly understood their business perspective, and they wanted to give something, but maybe not, you know, for free, but they would certainly be willing to support and help. So does that make sense?
What about like the major, the universities or the other major corporations we have in town? Is that something you have to write a grant to get help for, or?
The universities have reached out to us. We do have a social work intern with us now who has been fabulous. And she has been putting in at least, I want to say at least 2 to 3 days worth of helping in our social services department. So she's a great asset. We have the opportunity to have more students, and I just wanted to do one my first year, so we'll consider taking another one next year. But we have had a few requests for this internship from both schools. Fairfield University reached out to us with their women's basketball team, wanting to participate in a seasonal opportunity, inviting us to their games at little or no cost, and we did respond, and we were thrilled to do that. So we have had different areas, different departments offer interest as well as their expertise. So, yep.
Thank you.
Thank you.
Brian.
I actually, I don't have a question, I just have a quick comment. I applaud what you're doing. I still, actually, I don't really knock the doors, but I walk the area where I live in District 10, Brian Caffarelli, sorry, District 10. And there are a lot of people that use your service, and thank you. Thank you for what you're
Good.
doing.
I'm glad. Thank you.
Bill Perugini, District 10. To echo the sentiments of the others, thank you for that tour that you gave. It was quite impressive and very enlightening. You mentioned the evolution of the facility as more of a resource center rather than an activity center. Can you elaborate on the resources and programs offered, and how many of the 1,300 members participate or take advantage of those resources?
I think some of those 1,300 members may include people who come for, say, the AARP Tax Assistance Program. So AARP gives us volunteers stationed at the senior center who will do the income taxes for seniors at no charge. And that's a great thing. So there are many of those 600 that are not active regulars that just come for their taxes to be done, something like that. In that group also belongs the group that work with the lifelong learners who have a certain appeal for intellectual courses. They come as they wish to the certain courses that they see, and then they're not involved in anything else. So it's eclectic. I think people pick and choose what looks interesting to them, but there are a few that are just going to be there for a couple of times of the year. Oh, and to go back, I'm sorry, the resources.
Yeah, so do you collaborate with any of the other resource centers in town to provide those programs and services? Are there opportunities for collaboration with the library, for example?
Yeah, I'm going to be doing more of that. We do have a program that's currently of interest to some seniors called the Village Model, and this is an aging in place opportunity that other towns have explored, from New Haven to Greenwich to New Canaan and so forth. And so we are working with the library and other partners to at least hold information sessions and see if there's some traction and there's any interest. This is not something the town would sponsor, but rather it's an idea about aging in place, and so we would hold it as a meeting place at the senior center. The resources, we do have many professional connections with the Area Agency on Aging, the Southwestern Connecticut Area Agency on Aging. We have resources. We have a volunteer who gives expertise on prescription drug medications, insurance, which is the Choices program. And that is where she comes in by appointment and meets individually with seniors to help them choose or select a supplement to their Medicare insurance. And that's very helpful. Those kinds of resources, maybe people only come in for that, but it means a lot. They don't have to pay for it, and they can get personalized information. I think there is always the financial component. People want to know about resources, but more importantly, I think they want to know about home care agencies, resources to help them to make their money last longer. They're looking at classes, particularly on finances, to help them understand retirement and planning and so forth like that. So I think those things we are continuing to do and provide resources for. Does that answer your question?
Yeah, so how many people are served? And, I mean, do you have a rough idea how many seniors are served by those programs?
You know, I think we get between 30 and 40 people at some of those programs. We had a home health care fair at lunchtime, and that had about 100 people attending. So that had about 8 vendors. So, you know, that was significant.
All right. I'm going to ask at this time if there's any other questions, and in so asking, I'm going to remind the members of the RTM that we are 45 minutes behind schedule, and the chief, both the fire and police department are here, and the town is at risk. So are there any other questions? Apparently so. Okay. Brief, please.
Following up on services and other things that are run throughout the town, you mentioned the library, and you mentioned something about the village model. You use the library now to promote that, or?
No. I just wanted to we're promoting it at the senior center. We're holding information meetings. I just wanted to get out there and have it be in different parts of town. So we're going to have a session, say at Fairfield Woods, the Pequot, and the main library. Just, again, to make it user-friendly and make sure that anybody who's in that area gets a chance.
Okay. Are there any other services that you provide that are also run at the public library? For instance, I think someone mentioned that people can get assistance with Medicare, Medicaid, filling out forms, that type of thing. Is this correct information? It might be completely false.
Yeah, I don't think so, Pam. I think that was discussed, that there was a volunteer who wanted to provide the same services that we have at the senior center. Again, it was a volunteer from the Area Agency on Aging who was looking for a placement. So I'm not sure if she did find it at the library or not. But in general, I know that we are very steady with that business in terms of having people make appointments to come into the senior center.
Okay, so that's not something that's being done at the library as well?
As far as I know, no.
Okay, thank you for the clarification.
Sure.
Representative Newberger.
Ray Newberger, District 10. I'm just curious if there's any further infrastructural investments you see in the future. Are there any areas or aspects, technologically speaking, or software, where the senior center might be lacking or might come before the body to appropriate more funds in the future? Is there anything that's dilapidated, or do you feel that, how would you rate the services and technology that the seniors have access to?
I think right now we're fine. I think that, you know, we do have something in our budget to help with some of the renovations that we're doing. Right now I'm focusing on the dining hall. We've had children's furniture there for many, many years. So that was one of the first things I really wanted to do. So I am looking forward to getting some dignified tables and chairs for our seniors. We do have a mobile audio-visual television so that we can take it from room to room, as we have many more PowerPoint presentations that people are coming in and wanting to show the seniors. So we did just get that, which was a great asset. I think the My Senior Center database is being expanded now to include the senior bus transportation, so we can get that fully automated and we can get the statistics that we need from that. And then in the next month, we're working in social services to implement all of the social work clients so we can have that statistical information available too. Right now, they don't have any technology.
Okay. Again, we're running a little late. I'm going to ask quickly, are there any comments from the public? Seeing none. Oh, seeing one. Palmer Senator.
Thank you.
Palmer Senator, 42 Pilgrim Lane. Thank you very much for hearing me. I just want to say, I think that we're very blessed to have Terry. She's doing an amazing job, and she's doing a job with her hands tied, and she's still doing an amazing job. When I looked at the budget, I realized that we receive 0.18% of the total budget. We do most everything with volunteers, and I'm just confused, to tell you the truth, as taxpayer in this town, all of us that are taxpayers, why is it expected for us to do all of this? I don't think there's any other department that has to do as much volunteers to get things done. So I just would like you to think about that, please, and I think it's really unfair. And we're very vital to this community. We're not just charity cases, and we need to really look at that and look at it from that perspective. We do have people in need. They're not all seniors, and it's all right. I mean, it's our obligation, and definitely we have to take care of them. But there's another aspect of us. We are vital. We are part of this community, and we shouldn't have to. We should get a better appropriation. You know, I've been saying this for years, and I'm still not seeing it happen. But I have hope. Thank you.
Thank you. Any other comments?
I didn't want to be remiss in acknowledging we have received an $8,000 donation from Bigelow Tea to really do the installation for the My Senior Center. So that has been a huge technology help to us, and I just wanted to acknowledge that. The volunteers did install it, and the volunteers are implementing it, which is great.
Okay. Terry, before you leave the podium, I just wanted to thank you publicly, you and your staff, for hosting the Committee for Senior Tax Relief just this past weekend. Thank you very much. Your staff was great.
Oh, great. My pleasure. Thank you.
With that, Chief Fellner.
Thank you and good evening. As you know, we worked very hard on our budget to try to bring it right in, and we did bring it in below what it was from last year, and still give the same services, which is, you know, very vital and very important. So at this particular point, I'm sure that you have numerous questions you'd like to ask me, and I think that's the best way to approach this, if that's all right with you.
Representative O'Connell.
Thank you, Chief, for being here this evening, and thank you for delivering such a flat budget, so to say. As you know, there were some difficult personnel issues, decisions made recently by the Fire Commission, and the Board of Finance looked at the budget based on the decision of the Fire Commission, and in not renewing Deputy Chief Reed's contract, reduced your salary line budget by $50,000. Do you see this having a detrimental impact on your salary line? And I also know that there has been some public urging of the Fire Commission to reconsider that decision. If they were to reconsider that, what would the implication of that cut do to your department?
Pam, to go there right now on something like that, that's really up to the Board of Fire Commissioners, and I apologize, not being rude.
No,
I can't speak for them. Do I think it will have a big impact on our budget at this time? To be honest with you, no, we'll work around it. And, you know, there's times we just have to make things work. But to comment any further on that, I apologize, but I don't want to speak for the commission.
I completely understand. I'm just speaking from a budget perspective, if you were concerned at all about any budgetary impact there.
At this time, no. Tell you the truth, no, I'm not, you know, that concerned. We'll move on, and as we always have, and that's what the fire service is. We'll make it work.
Thank you.
Thanks, Pam.
Representative McKenzie?
Good evening, Chief.
Good evening.
Two questions. One, it came up when we were talking with Department of Public Works about the maintenance and repair that they have. And was there any possibility of consolidating what goes on with the police department and the fire department to get an economy of scale? What is your thought on that?
My thought on that, for my many years here, we sort of tried that at one time, but you take the public works. They're, especially during the cold season and the warm also, the summertime, you know, they would be handling fire apparatus, police apparatus, and their apparatus, and they have enough to do, honestly, down there without trying to combine everything. First of all, they don't have the room down there to combine this, and secondly, the mechanics have to be certified for emergency service vehicles. You can't just get a mechanic to start working on an emergency vehicle. My two mechanics that I have are certified for emergency vehicles. You know, it's not working on just a regular truck or something like that.
Right, but what I meant was if the workforce was consolidated, then let's say, maybe there's not a lot, but there's some downtime in the fire department, they could be doing work for DPW, or vice versa. DPW people who are qualified, who have some downtime, could be working on the fire equipment.
Okay. I understand what you're saying, sir, and I can honestly say, and there isn't much downtime. They're always going. You know, we answered almost 10,000 calls this year, and we're constantly going. The vehicles are on the road all the time, and what's very important is preventative maintenance. You can't just wait till the truck breaks down, especially when an emergency vehicle. It's not the kind of thing you can pull over the side of the road and get a tow truck. We have to get these vehicles back into service, and we do have a plan as some of our fleet is getting old, and we're moving forward. But in answer to your question, I feel, in my opinion from being the fire chief, no, that's not practical. And there isn't much downtime, and you're welcome at any time, and I really mean this from my heart, to come up to the maintenance shop and see what goes on. Even if the truck is not down or broke down, they do the preventative maintenance, because when we have to use this apparatus, you have to use it now. You can't say, gee, we're going to use it 5 or 10 minutes from now.
Okay, thank you. Second question was, on fees and professional services, what contributes to the increase in that line?
In fees and professional services, of course, we have to go to the outside now. The laws have changed so much with OSHA requirements, medical requirements, hazmat requirements, that we have to keep this up to par. It's not, things have changed so much just over my time. We didn't have to have OSHA, which we have to have that, what's confined space. We have to do all this, and it's all certification now that we have to report, you know, to the state. Also, fire inspections and everything like that. There's a lot entailed on it, to do this. You know, I hope, you know, I answered your question. I don't feel I really explained it what you really wanted me to. So maybe you want to sort of help me along here.
We can talk offline. Because probably very detailed, all the classes you have to have.
The what, I'm sorry?
Okay. Do you have an example?
For example?
Of the classes? OSHA is one of the...
No, we have an OSHA class, we have EMTs, we have to certify our people every 2 years, goes through the class. We have hazmat classes where we work along with the police department. We confined space, we have to have that, keep that up to par. We have to do our particular rescue work, which is required, again, by OSHA. And all these new laws are constantly coming. Even in the fire inspection division, for example, all restaurants and liquor establishments have to be inspected once a year. I mean, and there's quite a few in Fairfield. 3 family houses have to be inspected. And, you know, we have 3 inspectors, and it's, and all the new construction, all the remodeling, they're constantly on the go. So this is required, our EMTs. Every firefighter that we have today is an EMT, emergency medical technician, for medical calls. And we have to keep recertifying these people to keep up with it. We are designated by by the state of Connecticut as first responders, immediate response, along with the police department as supplemental responders. And we work with Fairfield U also on that. They're supplemental responders.
Thank you.
Okay, sir. You're welcome.
Thank you, Chief. Brian Caffarelli, Representative, District 10. I just wanted to follow up on Representative Iacona's question. And I know that when we've joked that we're keeping everyone here, and the 2 chiefs and the whole town is at risk, it was a bit of a joke, but I want to follow up on Deputy Chief Reed. I know that we're talking about dollars and cents in this budget, but those dollars go to make an effective fire department. And I've heard that he is an effective part of that fire department, and I do want to know your thoughts on it.
My thoughts, all my people are very vital. It's not just one people, it's not me. We have to work together as a team. And will we do that? Yes, we will. With things going on now, for me to get into it, I truly apologize. I can't go into it in case if there's any repercussions or anything. But, you know, we will move on. I mean, this is nothing that's just happened. I've been there many years. It's happened before, and we move on. We have to move on. We have some good people, everyone, inspectors, everyone is just about top-notch in my officers' ranks. So, but again, I can't go into detail with you now, and I apologize. And that's from the town attorney. We can't, it's best if we don't, put it on the table here.
Time for 2 more questions.
Good evening, Chief. Gaylord Meyer, District 1. I want to go back to fees and professional services.
Yes.
There's a big jump there. And I think for me, I need to be more comfortable, and I hope you can get more specific. You talked about confined space and why that is something that is new and you have to spend more time and money on that. What does that mean to me?
Confined space, for example, I'll go there and we had a worker fall in a septic tank. Well, who's going to go down in that septic tank? The firefighters went down in there. Confined space is required by OSHA. We had just recently people working on a building that fell down from the 3rd floor to the basement. 2 men went down there. We have to rescue that. We have operators where we have to go into manholes with proper breathing equipment, proper equipment, and everything else. This is what we do. This is what we're trained to do. And this is what we have to do required by the OSHA law. OSHA is very, very strict now. They check with us all the time, and we have to keep specific records on what we do, how often we do it. If something happens and we aren't trained for this, the town is open to be liable.
And you do a great job. Thank you very much.
Thank you,
I guess what I'm confused about is that the discrepancy from That's it's a big increase. And for something that's been in place
Mhm.
and that you've been doing a great job for a lot of years,
Mhm.
it just seems,
Okay, there is more, okay? And when we get instructors on some of this stuff, it costs more. What we did pay, and I'm just using numbers, shooting off the hip here, $10, we're now paying $20 to get some of these instructors. There's new manuals that come out constantly. Matter of fact, just today I ordered numerous training manuals that we have that brings things up to date, and especially in the fire marshal's office. The state fire code changes almost, I would say, every year, every 2 years. Hank, wouldn't you on the fire code how much it changes? And we have to hire these manuals and keep up with all of this, and it costs money. Everything has gone up like everything else. If I call an instructor in and if you ask me exactly what we pay now, I really, couldn't answer you. I will. I'll get that for you. But when he was getting, as I said, repeating myself, $10, he's getting $20 now, and then we have to do the record keeping too. And that will really, when we go on the state highway, you have no idea, Gaylord, and come down and I'll show you the record keeping that we have to do.
Last question. Joe.
Hi, Chief. Joe Palmer, District
Hi,
4.
Joe.
I think maybe, still sticking on this point, the fees and professional services, is this related to also, let's say if something happens, you mentioned on the highway, there's a spill. Not everyone in the organization has the ability to handle that, so you might have to have an outside organization come in and help. Is that some of what goes into this line?
No, we don't pay for that. The state, if we have anything on the turnpike, yes, we use equipment. Matter of fact, I'm in a process working with our administration and Mr. Mayor to start billing. It's not there yet. Is it going to be there? Yes, I'm very determined to make it be there. When we charge the out-of-staters, the truckers, we get a lot of fluids leaking, chemicals leaking out of trucks all the time. And we're going to start, hopefully it works, there's a company that bills them out and they take a percentage of what they go after, where we don't have to do it. So we did it at one time several years ago and the company went out of business and we pulled in, I believe it was almost $40,000 in billing, especially, not our local homeowners, our citizens here, it's the out-of-staters. For example, a hose broke at the service station when they were filling the gas. Everything went down the drain and everything. We billed the company out, and they paid. Insurance companies don't want to go there and start fighting us because arguing with us. It costs them more money to send all their lawyers down. So they want to settle. So we make up for that on a lot of our equipment, which helps now in keeping our budget down with some of the equipment.
Okay, so your fees and professional services line, and then the educational and memberships line, there might be a little bit of crossover in terms of you might have to hire an expert, someone who only knows how to train on confined spaces, let's say, and that might be in the fees and professional services line where that person comes.
Okay, and
the time,
when you're talking about education, Joe,
yeah.
That's some of our firefighters who want to go to different schools and classes,
Okay.
which is in their contract,
Okay.
and we pay for that. Do I make them come back with a report and teach the shift that they're on, the platoon they're on? Yes, I do. So when I send them, the town pays for it, which is required by contract. I make them come back and they hold a class. And we just recently, we're doing a lot of it in-house now with the TVs. The Board of Education helped us out on that, where we leave people in station and we can have them instruct from headquarters what he learned and what he did bring back, to the fire department in the town of Fairfield.
Gotcha. So it is a separate thing than certifications, let's say. Certifications are really what encompasses the fees and professional service line.
Yeah.
And then the education budget is, bettering each individual
Mhm.
based on their interest, helps you develop subject matter experts, all that. Okay.
Right. We're trying to keep that, in line and, make sure they bring back to the town and the fire department what they've learned.
Right. Gotcha. Thank you.
Pam, last question. Actually, I've got one.
Thank you, Chief. I hate to add to your work, but just in the interest of clarity, do you think you would mind just doing a quick bullet point sheet on your fees and professional services to, in writing, and send it to the moderator and get it back to us, just so?
Oh, yes, I'd love to do that. It's no problem at all.
All right, great, thank you. And
All
then
right.
maybe just a one-liner about your education
I'll be
services.
glad
That
to
way
do
people
that.
understand
Yeah.
the differences.
That's not hard at all. Just give me, a few days, because we're
Absolutely, and if you could just
doing
send
this
it to-
budget stuff. I have a commissioners meeting Thursday night, so
Putting out fires, no big deal.
you'll have it.
Yeah, okay.
And you know where to find me, so.
Thank you.
Chief, let me just, before I let you leave the podium, 2 of your overtime lines are up, not significantly, but they are increased. You're anticipating, are those increased overtime hours?
What section is that, Joe? I'm sorry.
On page 206, overtime earnings, vacation relief, and overtime earnings, business/other relief. They're both, is that a scheduling issue?
Yes. In other words, you take several firefighters have reached a 20-year period, okay? That's a longevity step. Is that where I'm going in answering your question properly?
Overtime is what I'm concerned about.
Okay, when he goes to a different step and you have to hire, we have minimum manpower to replace him, he's paid a higher rate. In other words, he'll reach a longevity step, and that's included in his pay. And if he works relief, we pay him more than when he didn't reach that 20-year period, we pay him less.
Okay, so it's the same number of overtime hours, but by virtue of the fact it's the same number of hours, but at a higher rate, is what I'm hearing?
Mm-hmm.
Okay.
Yes, yeah, definitely. That goes up. That constantly goes up, and it'll go up again more when people reach the 20-year period.
All right, but again, the aggregate number of overtime hours is constant in relative terms. Is that-
Yes.
Okay.
I hope I answered that.
Fair enough. Any comments from the public? Seeing none. Chief, thank you.
Okay. Thank you very much, and Pam, I'll have that for you. If you have any other questions, please, my door is open, and don't be afraid to ask. And if you want to take a tour, or some of you did, thanks for coming that day. We'll do it again. We enjoyed it. But thank you.
Very
Have a
good,
good
Chief.
evening.
It's not a bachelor group. Thanks.
Right. Thank you.
Chief McNamara? Liddy?
Yes, I have Deputy Chief Liddy and Captain Smith here, too, in case there's some questions that might fall under their expertise.
Very good. Sorry to keep you waiting.
No, it's okay, and the town is quite safe. We have a full contingent, of officers out there 24 hours a day, so...
We all feel better.
Yeah, exactly. You should. Thank you. Just really a quick little overview. The police department covers not only public safety and from the law enforcement perspective, but also under the realm of the police department falls our emergency communications center. Now, it's a joint center, 911 center, that dispatches both fire, police, and ambulance, but we also have a separate budget for that under ECC, Emergency Communications. And also under the police department is the animal control office, and they have their own separate budget. However, responsibility and overall management of both of those units fall under the police department. Just to kind of give an overview, and certainly want to get right to the questions, law enforcement over the last 26 years is changing. And just to kind of give you a perspective on it, law enforcement model in the past was really respond, resolve, and move on. We would respond to incidents, resolve it in some form or fashion, file a report, and then really move on to another activity. And over time, and I'm not saying it's changing overnight, but gradually what you're seeing is law enforcement, the model of law enforcement is changing. When in the past we might be a mile wide and only dig an inch deep into some of these calls, we really now have to dig deep into a lot of these calls for service. And it's not something that we are inventing. It's really just something, the nature of the calls that we're being presented with. Our calls for service surrounding mental health issues is on the increase. Our calls for service with people that are harming themselves at times or have thoughts of that are on the increase. And I'm not saying that it concerns us, certainly concerns us, but it requires a digger deep into the situation. We all hear after Sandy Hook about the new gun laws and the regulations there. Well, obviously when we're presented with some of these calls, we want to find out whether there's any weapons, whether there's any information that we can find to really establish what's going on. And it's requiring us to dig deeper into a lot of these calls that in the past we may never have had to do. I'm not saying that is an impact on the budget yet. On some of this stuff it might be, but it certainly requires a lot more time and energy, and law enforcement in general is being asked to do a lot more than we probably have done in the past. And it's simply because we are a 24-hour-a-day service, so we are always out there, and people oftentimes look to us for some sort of resolution. So with that, just as an overview, I'll certainly be more than happy to answer your questions or dig deeper into that answer.
Hi, Chief. Liz Ezema, District 6. You are partnering with services in town, organizations, nonprofits. I don't want to call it mutual aid, but I assume that you are referring people to them where necessary. Who are you working with besides Fairfield Counseling Services?
Well, besides Fairfield Counseling Services, we work with a variety of other agencies. Bridgeport Mental Health, which is more of a first responder in the area of mental health. Several years ago, we have trained several of our officers to be crisis incident team officers. And what that really involves is giving those officers, a select few officers who are on patrol, so they're still in the patrol field, extra skills to try and really dig deeper into people's lives to try to help them through a crisis and get them the services. We've teamed with Bridgeport Mental Health, and we now have a Bridgeport Mental Health volunteer who oftentimes rides with us, so has teamed with us and is out there on the road. More just familiarity, but certainly out there to help us in that. So Bridgeport Mental Health is one aspect. The Center for Family Justice, formerly the Center for Women and Children, is a big component of our domestic violence approach. Our response to domestic violence has changed greatly over the last several years, and in fact, over the last year, it's changed greatly also. Where in the past, our response to a domestic violence call would be resolution, probable cause an arrest would be made, or separation. There's a lot of other things we have to do. The state, and we are partnering with the state with regards to GPS for offenders, for certain offenders. If we arrest somebody on a domestic violence call, they go to court, the court may put a GPS monitoring system on them, which now we are in tune with other agencies. If that GPS system triggers a response, then we will respond to that over a period of time, could be months. We also do a lethality assessment on these calls, again, teaming with the Center for Family Justice. A lethality assessment, our officers at every domestic violence incident, regardless of its severity, will now do a lethality assessment. And really what it is a in-depth interview to determine the likelihood, or if there is any likelihood, that a victim may be subject to lethal force. If that's the case, we partner with the Center for Family Justice to refer and make referrals, at the very least a phone call to make those connections. Those are just two, but clearly we partner with both universities and their mental health departments on matters affecting students. RIASAP, another one that deals with youth crimes, and forgive me, I'll back up a few minutes. The Center for Family Justice also has a component that deals with some of the child crimes. In other words, mostly victims of sexual assaults who are younger children are youth detectives. We have 2 youth detectives that will investigate those, and oftentimes they partner on a regional basis with the Center for Family Justice and the surrounding departments. The Center for Family Justice represents 6 towns. We are one of them. they'll all get together and maybe do a forensic interview or determine what the most appropriate action would be depending upon those cases. We also we have a regional burglary squad that our detectives team up with in the region, a Fairfield County Trainers Association that we look to, combine with to do some training, as well as the departments in town that we obviously work well together in an emergency, but those don't happen overnight. We have to work together on a daily basis so that when we have those hurricanes and other events that tap our resources, we can work together. I'm probably missing a few, and I apologize for that.
Thank you.
Representative Walk?
Hi, Chief. Jay Walk, District 6. Thank you for everything you do for our town. I do personally appreciate it. My question is, I remember last budget season, I think I asked the same question. How are you with officers? Are we short? Do you need more officers? Are we along the lines of other towns in Connecticut? I know Greenwich had about 5, I think, or 6 more than we did for the same population.
Mm-hmm. Yeah, I think that last year's discussion focused on the increase in the officers based upon, and I can dig through the information that I have here because I'm sure I have it here. We made a comparison of several comparative departments with a population of. Give me a second, I'll just get it for you, so I'm not just talking off the cuff. But last year's discussion certainly focused on the request, I believe the request we had put forward for 4 new officers.
Right, I think it was 4.
And that request was denied. I wouldn't even say denied. Some of it was withdrawn because we thought we may get a federal grant under the COPS grant based upon the Sandy Hook incident. That grant came out. It was different than what we thought, number one, and then second to that, we didn't get that grant. We didn't qualify for that grant. Or, frankly, everybody wanted that, and they only had limited funding for it. And so as I look for that, I'll get this, and this is dated information, but what you'll see before us, and I'm sure the discussion will come forth with regards to the school security unit this year, what we're now looking at is, we made some adjustments, and we certainly looked at our resources and tried to get a little creative with that. So we're only actually looking to increase our table of organization by 1, which would bring us to 108 as opposed to 107. Now, keep in mind, several years ago, we were at 108 officers, but it was defunded down to 107. And I don't have the date of that. I can certainly research that, but it was 108, now it's down to 107. So we're looking to just increase that by 1 officer. But I'll keep looking for that.
And one more, Tom, if I could. And fleet, your cars. What would bring you up to date, and how many cars would you need?
Well, the car debate, I'll jump to the cars first because I have a sheet in front of me. And I can get you any of that information with regard to the officer stuff. I have it here, but I can certainly provide it for the lack of time in an email. The cars, if you recall over time, the Ford Crown Vics...
Losing parts.
Crown Vic, Ford did away with our traditional police model, which was the Crown Vic. And we had talked over the last several years that we were going to be having to go through a transition, which we are in now, and we're kind of successfully have transitioned our fleet. You may notice the complete remake of the vehicles. Ford came out with a Police Interceptor, which is an all-wheel drive vehicle, which helps because it's better in the snow, which eliminates the need for mechanics putting chains on tires, even with a little bit of snow. And so we have 2 models of those Interceptors. The first is the sedan, and then the second, which you might see out there now, is the SUV. It's on the same platform. They're both police rated for safety, which the Ford Explorers were not. So now they're all the safest vehicles that we can put out there. And we've transitioned now into those vehicles. Over the years, and this predates me with regards to the decisions for the vehicles, the formula has always been for this organization that we believe the purchase of 12 vehicles keeps our fleet active and safe and keeps them moving from primary vehicles down to secondary vehicles and through our fleet. We put a lot of vehicles on the road. Every day we put at least 11 vehicles on the road 24 hours a day, running 24 hours a day. And not only officer comfort, but also that's a significant amount of wear and tear that those vehicles put on. put on them. And I don't remember the year, but I remember one year it was decided that they would back down from that 12 vehicles. And what happens when we purchase our vehicles, we get the highest warranty we can get, and so that obviously if something breaks in that warranty time, it's not going to be expensive. But as it trickles through its service, we just believe that buying new vehicles to replace the primary vehicles is significantly important to keep those first-line officers in the safest mode of operation they can do. And at the same time, as these vehicles wear out their time in different divisions, they're now being pushed out to other areas in town that are not necessarily as crucial or vital to us. What they found when they backed off from the 12 was, over a period of time, the expense became more difficult when the vehicles were breaking down because they're out of warranty. That was the model of 12. We unfortunately, or fortunately, depending upon how you look at it, the reality is the expense of our vehicles is increasing because the new Fords are technologically advanced rather than the old Ford Crown Vic, so they become more expensive. And what we saw was an increase in new equipment that we had to put in these new model vehicles. We also had, you may have seen this, we used to have Tahoes. We had 2 Chevy Tahoes that are certainly more expensive in our fleet for accident officers. What we're trying to do is consolidate our fleet, so we make them all Ford products. This last fleet we were able to, rather than order Tahoes, we got 2 Ford SUVs for the accident cars because they just couldn't function anymore. So we are still transitioning from it. And you can see in our budget, we've only requested 10 vehicles this year. So we've already cut ourselves 2 vehicles. And I think over the years we've gotten cut to 10 anyway. So that's the reality of it, is that they're just too expensive to continue asking for 12 vehicles.
Thank you.
Representative Donovan was next.
Hi, Chief. John Donovan, District 1. I did a tour of the senior center, and I was surprised to learn that Connecticut, I guess, is #1 in elder abuse for the country.
Okay.
Is that a concern in Fairfield, and is that something that you've seen?
We have, I don't know that to be true. I mean, I believe it.
I don't know it to be true either. It was just something someone said.
No, I understand it. So forgive me if I'm not going to be able to accurately discuss whether that stat is accurate, but we've certainly seen our share of. Our population, we know, is getting older, and I believe that our senior population is probably around 11,000 or so in town. And we see the traditional crimes that elderly people can be the victim of, which could be abuse. I know we've had some abuse cases in some of our private care facilities, which is certainly concerning to us. And there have been occasions where we've had elderly abuse of family members, abusing other family members. So we certainly are aware of that, and as the population gets older, that's certainly a concern of ours. We do a lot of outreach with the senior center to try and reach that population. One of our other concerns, and you've probably all been aware of it, are the continuation of these scams and the phone calls, the people in person. There's a criminal element out there that targets seniors for crime because of their vulnerability, because it's a trusting population, because they want to trust us. They generally have a nest egg, and so people know that, and they're targeted for that, and there's a variety of ways that they do that. So we're always looking at 2 things. One, investigating them when they happen, and at the same time, trying to get the word out to prevent them. But it really takes a culmination of caretakers, private facilities to be aware of it, and point of theft, which could be Stop and Shop when they try to wire transfers or other things. But yeah, the elderly, the crimes, increasing crimes on elderly is always something that we are looking at.
Thank you. Got time for 3 more questions. Bateson.
Thank you. Ed Bateson, District 3. Thank you, Chief. 2 questions. I see here the Homeland Security Connecticut Intelligence Task Force, the designation of a patrolman to a temporary detective status. When that when this program expires, will that officer remain a detective?
No.
So we're still effectively 15 detectives.
Yes, yeah, that's just a temporary assignment.
So in other words, the police commission did not promote this person to a detective?
No, and they won't be able to retire out of that position at a higher grade. It's just because of the nature of the work that they're doing. It is more of an investigative standpoint. They get a bump in pay, an 8% bump in that salary. But that reverts back once that program is ended.
Okay, currently or in the next fiscal year, how many officers do you anticipate to participate in like external task force, like regional narcotics, anything? Do we participate in programs like that?
You know, it's always certainly it's something we need to do, but it's always a constant battle of resources, depending upon staffing levels. So I'd like to continue this officer in this one program that he's in.
That's the only sworn officer we have participating in external programs?
Currently, that's the only one, yes.
And that's the only one you foresee for this budget?
I don't know. I don't know, depending upon the resources and depending upon, some of our administrative decisions that we go forward on. You know, we've had officers in gang task forces and other narcotics enforcement task forces, weapons, but I don't know at this point whether or not we'd be able to put somebody in one of those or not.
Okay, thank you.
Representative Meyer.
Yeah, Gaylord Meyer, District 1. Could you help me? I'm looking at fees and professional services. You're up on that. Could you tell me where the expenditures are, please?
Yep, hang on. Does it show how much we're up? I can look it up. But
You're on 53200.
First
Fees and professional services.
Does it say how much it's up from last year?
7%.
Okay. I believe that we are going to anticipate doing a promotional exam upcoming in the next fiscal year, and that's where that rise is.
Say that again, I'm sorry.
We anticipate that we're probably going to have to run some promotional exams. Fees and professional services cover a lot of different areas.
Okay.
And I'll just run down a few of them. One of them is the Cogent, our fingerprint system. If you recall, we used to cover that under asset forfeiture, federal asset forfeiture. That was $14,000 a year that we rolled into the budget because we certainly couldn't continue to pay an ongoing expense out of an asset forfeiture account. That covers new hires, crime reports, promotional exams, specialized forensics. Some of our police information networks that we utilize are our POS system, but my understanding is that might be the, hang on 1 second.
Oh.
Wasn't the POS system, didn't we expect the POS out? That would expend for what? That would increase, okay.
Chief,
I'm
if
sorry.
you'd like to send a list, that would be
No,
more...
I will do that, but I just want to explain it.
Okay.
And this might not have made it to the other, we have a program, an IT program that is scheduling software, and that used to be in the IT department. And so we took that 5,000 to put it into into fees and professional services. But my understanding is, I got an email today that I think they removed that and put it back in IT, and I didn't catch that part of the Board of Finance part.
Okay. And just one other quick thing. We're coming up against another tough budget season, and they're saying don't raise our taxes. So the question to you is, what are you willing to give up to help with this budget?
You know, I think that we have a very lean department budget, and as I started in the beginning, there is a lot of demands for our services, and this is a tough budget time, and we recognize that. And I think that's kind of why we got creative in the way that we did with regards to the officers that we requested again. I think it's an effective and efficient and responsible budget to provide the public safety service to the town. And I'd be reluctant to think that I could remove something from that budget.
Thank you.
Representative McKenzie.
Hi, Chief. A couple of quick ones, I think. One on the Emergency Communications Center. Assuming you could get the same level of service, would it make sense to outsource that?
Well, yeah, no. I mean, you know, No. And I'll give you...
I know some towns have done that.
That's why I'm having difficulty answering it, not because I don't want to or I don't understand it. I'm just trying to explain it. We used to have police officers that were answering our 911 system. Then, many years ago, we civilianized those positions. And those positions go far beyond just answering telephone calls. They are trained in emergency medical dispatch, meaning that they now, state requirement, if you call and indicate someone's in distress, they will ask you specific questions and provide you guidance to hopefully save someone's life. So there's a medical component to that. There's state access to records that they have to have. So it's like the role of a police officer with regards to confidentiality and the access that they have to things. So there is nobody to outsource that to. But having said that, we are looking at ways of maybe combining centers with other towns. We're talking with some entities to see whether or not that is feasible. The state is encouraging it or was encouraging it at one point or another. However, it requires all municipalities to get together to do that.
Okay, thank you. Second is, I'm told there could be some savings in crossing guards if they were on the BOE payroll as opposed to yours. Are you familiar with that?
Well, I don't know who said that there might be savings.
Well, the savings that they're talking about is that on your payroll, they when they break for vacations, they go on unemployment. Whereas if they're part-time through the education, they don't have to do that, and they get paid at a different rate.
Yeah, I would not be opposed to that. We have talked about that in the past. I think the only thing to keep in mind is that I still think the responsibility for supervision of it would probably fall to us, just because if there was an issue with the crossing guard, they're generally going to want a police response to it. In the past, however, keep in mind that I think the town at one point did contract out that whole responsibility. In other words, hire a private firm to do that, and I just don't think the service was there to do that. But I'm certainly willing to have discussions about moving that over to the Board of Ed if Dr. Title or somebody decides to kind of entertain it. I'll certainly discuss that.
Okay, thank you.
Could I answer one of your questions, though, David?
Yes,
too?
thank you.
Because you mentioned the...
Well, I'd be interested in the next step on the emergency center.
Okay.
You know, what comes of that? What would the savings be?
It's very infant stages of it. The state has at one point, my understanding, maybe offered some money if people were to consolidate, but I don't know whether that still holds true, but we are exploring that as an option.
All right, thank you.
Okay, David, but my one other question I just wanted to get to you, and I apologize for time. You had mentioned it, that's why I wanted to address it. You had mentioned about sharing mechanical work and sharing with Department of Public Works. Keep it... Okay. Keep in mind with regards to the mechanics, we have a full-time police mechanic who operates out of our building, but does not only fix the cars, he's responsible for the generator that we utilize if our 911 center power went out, so he always has to maintain that. He maintains all our fleet of vehicles. But when he goes on vacation, so oftentimes if we will leave that empty, but we'll call the Department of Public Works mechanic up to do something if there was an emergency. What's critical for us is we need to have a mechanic on site dedicated to the police department, because it sounds like it would be a good idea. Hey, if there's not a vehicle in our bay, then go down and start working on something down at Department of Public Works. But things crop up. It's 24 hours a day, and it really, you know, a car gets a flat tire, he's got to go out there and fix that. So it's difficult to do, but certainly we're not opposed to helping each other out at times. But to take that mechanic away from us would just be ineffective and inefficient for the way that we do our operation.
I got one question. Chief, two of your overtime lines are increased 5%. I asked the same question of Chief Fellner. Could you speak to that increase in overtime spending?
Sure. When we did this budget last year, if you recall, the police contract was settled after this contract was done. So now, as a result of their settling the contract, that is a 5.5% increase. So all we did was multiply that by 5.5%.
Got it. Okay. So we already ate that lunch. Yeah. All right. Representative Kona.
Thank you, Chief. On the crossing guards, if I understand moving that ledger item and cost item over to the Board of Education, and then that the savings from, obviously, then your department goes over to the Board of Ed, which there's this discussion about the true cost of education and getting there.
Okay.
However, would there really truly be a savings overall to the town in doing that? Do you know?
No, and I didn't say that. What I said was that I would be willing to move it over if there was a savings. I think someone else brought up the fact that there would be a savings. I don't know whether there would be a savings.
Okay.
But there has been a lot of discussion with regards to whether or not they should move over to the Board of Ed.
Okay.
I'm not opposed to that, but I'm not clear on whether there would be a savings. Clearly, there'd be a savings in my budget, but I don't know whether the town budget would save it.
Okay, so overall, we don't know. That's
I don't
something
know.
that could be discussed at a future date
Yeah.
of whether or not that would cause a savings for the
Sure,
town
sure,
overall.
yep.
Okay.
Okay.
All right. And then along those lines, you said, though, that you would want to maintain supervision of that particular unit. Is that a group that's unionized or?
No, they're no.
They're just civilian employees?
Part-time, yeah.
Part-time?
Part-time.
Okay. And you see the supervision maintaining with you just obviously for safety reasons and the things that happen
Yeah, I mean, I think I'm not saying I'm not even against that. I just think it would be discussions that we would have to have. My main concern would be that it would remain as efficient and safe as it is now. So whoever is responsible for it, let's just make sure that it remains a quality program.
Thank you.
Last question. We're really behind you.
Okay. Ellen Jacob, District 9. A question about resources. What would you say, I don't know if you can even answer it, the percentage of outside calls are? In other words, calls in which your department is asked to work on cases or incidents outside of Fairfield, Bridgeport, or any surrounding towns. Does it ever become a hardship for you to take care of us in Fairfield and do cooperative ventures with others, other police departments?
I don't think it happens all that often, but we have the lines on the map are really when it comes to public safety are really just lines on a map, and oftentimes these crimes overlap different jurisdictions. So. Look, just as much as we cooperate with other agencies, we have other agencies cooperating with us. Down the beach every year, at times when the Fairfield University events take place, Bridgeport sends their entire contingent of horses over to us to help us that entire day. Westport brings in resources all the time to help us. So I think it's kind of a mutual thing. Our number one priority is public safety in this town, but we all know that we all have to work together. We're a very small state. And I'll give you an example of Sandy Hook. We certainly responded with resources up there. However, the first thing we did was make sure that we had police officers at every school in our own town to cover that. And so I don't think it becomes burdensome at all.
So our resources go to our town needs first, and then whatever.
Oh, yeah.
Thank you.
Certainly.
Any comments from the public?
Good evening. I'm Kristen DeWitt. I live at 289 Davis Road here in Fairfield. And I actually want to start off by thanking Chief McNamara and Deputy Chief Liddy. They each took their own time and came to many, many school safety meetings across our town at different schools. And this was their own personal time. So thank you very much for your continued commitment. I do want to thank First Selectman Mike Tetro. I saw him actually exit the building, but it was because of Mike working with our chief that the budget addition for school safety officers was added this year. And I guess lastly, and most importantly, why I'm here is I recognize, Representative Meyer, it's going to be a tough year, and people are concerned about taxes increasing. But I respectfully ask that you pass this budget, this police budget in its entirety, so that our police force can have the resources it needs to proactively protect all of the town residents. Thank you.
All right then. Any comments from members? Right. Next up, library.
Hi, I'm Karen Ronald, the town librarian. I brought Jan Fisher with me, the assistant director. Do I have a few minutes to convince you we're fabulous before we speak, before we have questions? I just wanted to mention that we now have a budget, a staffing budget and library materials budget of what we had 10 years ago. And I think we need to remind ourselves library services have changed considerably since then. We didn't have a teen services department. We didn't have teen services collections or programs. We do now. We didn't have digital services. We didn't have digital audiobooks. We didn't have digital streaming music. We didn't have a lot of the programs we have. We actually have responded to community needs. A lot of this information hopefully you've already received. But we do have an award-winning job series, and we have 89 people who've actually told us since they've come to the job series they've gotten employment. So we're very proud to be part of that change in our economic health in our community. We do some Health Care Act counseling with partner agencies, just like the Senior Center. And I think we probably have some duplication. I would tell you that's because we're open evenings and weekends, so we have a bit more, people have more access to us in the Senior Center at this point. So let's think about the library as really a 21st century place, and we're trying to do the very best we can with the budget we have. Do you have questions?
Representative Iacono.
Good evening, Ms. Ronald. Pam Iacono. I was supposed to meet with you today. I had a family thing come up, so I apologize for that, and thank you for offering the tour. I have a couple of questions. One surrounding the programs that you offer for teens, what they are, what exactly a teen librarian is responsible for, those types of things. Can you run me through a typical day and their responsibilities?
Well, teen services, there are basically tracks when you go to library school. You do a master's in library and information science, and usually you choose a track. So you might choose to be a children's librarian or a teen services librarian. And possibly when we were younger, teens, there wasn't even such a thing as teen literature as far as a whole genre. So now we're getting into social issues literature, Common Core associated with that age group. We're talking about kids who may have social problems or challenges in the community who actually lean on their teen librarians as mentors. And we do see this almost every day in the library. The branch library has something called the Down Under Space, which is actually an initiative of one of my colleagues here today, Nancy Coriati, and we have 30 to 40 teens who rush down from the middle schools into the branch library, and they're mentored by teen librarians. So they may get help with homework. They may just be a nice, kind, supportive ear. They may actually direct them to some literature that may change their lives. So it's really a specialization within our library discipline. We have about 4,400 teens, I believe, with library cards right now.
I'm sorry, what was that number again?
About 4,400.
And how many of those get used regularly? Are you able to track?
No, we don't track use of individual patrons. That's sort of a privacy issue. But we do have regular, obviously regular patrons and people that continue to return.
Okay. That's interesting. It's a privacy issue that you can't track the number of people that actually use.
We track the number of people. We do not track the number of teens based on gender or age or anything like that. I can tell you how many people came through the doors last year. $539,000. I can't tell you how many of those were teens.
Okay, is that because they're youth members, or?
Well, no, because we have door counters, but they do not tell us the age group. I can tell you, I think, actually, I can't tell you that number off the top of my head. We did send you documentation that actually told you how many teens actually attended programs. I know I think it was over 300 or 400 attended summer reading last year, but I can't remember those numbers. You were sent those, I can get them to you again.
I remember reading that, but you're not able to, when you swipe your library card, you're not able to tell us anywhere how many people checked out a book?
No, I can tell you a total number. I can tell you that we
But it's
had...
not broken down by a demographic. Is it possible to get, was it in our packet, I apologize, the number of people that actually checked out books from our library or materials?
We know that we have 38 to 39,000 registered library card users, which means they've used their card in the last 3 years, because every year, every 3 years, we ask them to renew their card. So we know we have that many people using the library.
It's not just in their possession, they actually are
Yeah, they're
physically
using them.
their card. You
Yeah.
don't have a breakdown by year, though.
No. No.
What would you need to do in order to do that, to get a breakdown?
We wouldn't do it by year because it's based on a 3-year cycle. I can tell you that close to 1 million items were circulated last year. I can tell you that over 500,000 people came to the public library system. I can tell you things like that. I can't break it down into individual users over a year. Can't really do that.
Because we don't have the information technology to do that?
Yeah.
Okay, all right.
Yeah.
That might be something to look for going, I think. I mean, just if the senior center can swipe a fob and know who's coming in, there ought to be some way to do that at the library, you know, in my personal opinion. One of the things that was raised at the Board of Finance meeting was the purchase of materials, conversations about movies, videos, the types of media that people come in to check out. And you mentioned that the library is still purchasing VHS tapes.
No, I may have made an error telling you that. No, we just actually keep VHS on our shelves. We're not purchasing them anymore.
Okay.
But we do know that we have people who don't have anything other than a VHS machine at home, so I am fairly reticent to get rid of those at this point in time. We're starting to move over to DVD, some of the classics, if we can get them, and then hopefully we can move to streaming and digital at some point. But we're not buying VHS anymore.
And I also know that a couple of years ago you purchased the automated checkout center and didn't have much success with it and moved it upstairs, I guess, to the children's library.
No, we have 2 self-checkouts only at the main library, and they were tagged at the time. Every item in the main library had to be tagged at the time we renovated, which is almost 9 years ago, come this summer. And what we found out that this was basically bleeding edge technology at the time the renovation went in. It was very exciting. I wasn't here, but I can tell you the capabilities of those machines do not really match what people want here in town. If you have an overdue fine, you cannot use that machine. If you'd forgotten your library card, which many of us do, if you have an ephemeral item like a magazine, etc., that doesn't have a tag, you cannot use that machine. You cannot get a hold. So if you placed a book on a hold online, you cannot use that machine. So I think really it was that sort of first generation self-checkout. So we did in fact move one up to the children's room, and we still find that it's used minimally because it has low functionality.
Are there other machines that you're looking into to increase that?
We'd love to. We talk to vendors all the time, and they're telling us that if you wanted to really ramp up circulation, which is the front desk checking in, checking out, it would cost between $300,000 and $500,000 to get it up to speed and would have high functionality. You'd still have to have staffing. Libraries are labor-intensive organizations. You can't remove the staff and still have a public library. You can actually reassign some of them, but we've even looked at really high tech. There are libraries with robots running around in Chicago, and academic libraries. Humans are still involved in swiping the items to put them back on the shelf and reshelf them. So I don't think we're there yet. Maybe one day.
So you are looking into technology?
Well, yeah, we talk to vendors all the time. And I'm telling you right now that the last estimate we got for part of that system was about $350,000, $400,000.
Okay, thank you.
Hi, Joe Palmer, District
Hi.
4. Hi, Karen. Maybe if you can take us through, I'm sure you have a process where there are some technologies or, let's say, licenses or that you have for different products, like database products, or you mentioned the VHS, where it's kind of an outdated thing. What's the process for kind of getting rid of these things that have, let's say, low usage, and adapting things that maybe are, at least you mentioned bleeding edge, it was a different type of, so it wasn't like a resource, but it was,
Right.
but what's that process like in terms of, evaluating things based on usage and datedness, et cetera, and kind of removing them and finding new things, let's say, that might be more up to date or maybe more affordable?
Well, we have something called a collection development plan, which is a professional development, almost like a manual that's over 30 pages long, and it basically describes how professional librarians select materials based on all sorts of stats, community needs, condition of an item, whether it fits in our collection, whether it will go out, etc. So that's sort of our guiding principle, and all librarians use those tools, and it's sort of tailored to our community. When you're talking about moving to different material items, that's why it's really important for us to have professional development and training and be able to talk to vendors and publishers and really sort of track what's going on in the library world, the digital world, the information world, because we're absolutely part of that. So the process could be something like, if we're looking at a database, and we're always looking at databases, we would actually talk to a vendor, we'd talk to our colleagues, people in other parts of Connecticut, Northeast, et cetera, maybe the US, find out how it's used. We would test it. We usually get a 30-day trial free, and we get all sorts of different people and different, on the staff, different strengths, et cetera, and interests, and see if we'd like that database and if we can afford it. And then we track the usage of that throughout the time that we have it. When our library materials budget is cut, then we have to think about cutting those, just like we would do any kind of magazine subscription or database subscription. I'm not sure if that answers it.
It does. It seems like you do have a process, and you're looking at usage, and let's say if there is low usage on something, you're looking to either replace that or just eliminate it.
Absolutely. Absolutely.
Representative Marmion?
Hi, thank you. I just would like to get some information. One of your budget requests for an increase is an upgrade to the online library catalog of $26,000. Can you give us some perspective in terms of what's driving this request, in terms of, I'm assuming, patron requests, or is it more the future of where books online are going in the library system?
I'm going to give you a general answer, and then I'm going to ask Jan Fisher to come up here. The online library catalog is basically our mission-critical operating system for the library. So if you're checking in a book, checking out a book, placing it reserved, seeing what we have, etc., that's the operating system you use. And we do pay a maintenance cost on that every year. And every so often, like any other software, there are new editions, new versions, etc., new capabilities, functionalities. And we want to keep up with those developments so we can add better service to the library. For instance, if we were to upgrade this time, we might be able to go to a school and actually not just sign up kids for library cards, but produce the library cards right on site. And that's what we want to do. We did it last year in sort of a manually, very intensive way. We want to be able to go out into the community, go where the people are, and give them the card right on the spot. So that's one of the functionalities we'd have with the new software. Right now we're using a very old IBM server. The software company that we subscribe to the online library catalog is no longer going to be operational on that IBM server. We need to either buy a new IBM server or we would like to migrate to the virtual environment, which is now housed at the branch library, and that's part of the town system, and we are actually part of that. I can ask, Jan can answer more questions, and really my technology librarian is supposed to be here, but he's not. So if there are, really specific technological questions, I can certainly get back to you on that.
I just want to say the reason that we really need this year is because that server that we currently have must be upgraded or it will no longer work with the system that we have. That is the lowest option, is to upgrade it, and it's really not the most cost effective in the end. To buy the new server is a little bit better because it buys us another 5 years. As Karen said, what we had wanted to do was move on to the town servers where we wouldn't have to worry about upgrading our servers any longer, and we'd have a very low annual maintenance cost. But the stumbling block with that is that we need to spend $26,000 to migrate our data so that it would be acceptable onto the town server. And then after that, it would just be simply $800 a year instead of $2,000 or $3,000.
So we would have a potential, once the initial investment is made, a potential cost savings moving forward. That's the bottom line. It's an investment in...
That is correct.
Okay, thank you. And then just a follow-up on that, the second cost increase that you're asking for is the installation of a security camera at Fairfield Woods. Is that correct?
Yeah. We had conversations with Mr. Tetro, and I believe there's going to be more of a town-wide initiative. So yes, we do want cameras and more security at the branch, but we'd like to wait and do it as a full town-wide plan. So
okay, so thank you.
yeah, it's out of our budget request now.
Thank you.
Representative Donovan?
Thank you. And
Hi.
thank you for the tour. It was
Oh.
great when I went earlier. Question for you. So, and my voice is losing me or leaving me. The town, it looks like the budget for the libraries is 3.6 million around?
No, 4.1.
It's 4.1, okay.
you look
So
at-
that's when it adds in some of the other expenses.
Oh, sorry, yeah, after the cut, sorry.
So after the cuts, 3,649?
Yep.
Okay, and that's roughly 500,000 visits?
Yeah, close to 540. And the reason that number was down last year is, we had our hours cut. Before that, in other years, we were up well over 700,000 visits.
Do you have a breakdown of that from the town versus the branch?
Not exactly, but I can tell you about 25% of most activity, and it's just the way it works when you look at the numbers, is from the branch. So all the program attendance, all the circulation, and all the door counts, it's roughly 25% of any number I give you happens at the branch.
Okay, and would that also be the cost?
We have had this question before. I can tell you that's difficult when we're trying to run a public library system because, for instance, if I go to the branch, where do I sit? Do I sit at the main or the branch? Do I count every visit? I have a deputy town librarian who sits at the branch but comes to meeting at, we also share resources. Our technology is shared. Our databases are shared. Our digital resources are shared. We don't buy a digital item for the branch and a digital item for the main. It's all shared. So it's going to be a huge challenge if you want this, and I'm not sure it's that efficient to do that. I think we're already highly efficient.
Okay, so what you're kind of advocating is a lot of sharing. So we've got Fairfield University Library, Sacred Heart Library, Pequot Library. It doesn't seem that the same level of sharing, and when we look at these things from a technology standpoint, it'd be great to be able to go to one and know what exists at the other, or know that you can leverage these resources.
Okay, well, you can do that with the Fairfield Public Library System. The Pequot Library share a computer catalog. So when you go on, you can see what's at Pequot. You can also see what's the Fairfield Museum, too, and the two public libraries, so you can do that. Maybe, hypothetically, optimistically, that you could move from public libraries and academic libraries and school libraries all being able to be on one network and database, but that gets into, missions and all sorts of other things. We do know that if people want to if they have a public library card, they can go to Fairfield U or Sacred Heart and purchase, use 2 items at a time. So we have that reciprocal arrangement. We don't have much more than that at this point, and I think it's just different entities and different missions.
One of the things I look at is what would the metrics be to kind of compare the different uses? Do you think cost per visit is a fair way to look at the library system? Is that a metric you would use?
Well, the metrics we use, most public libraries in the U.S. Would start with the circulation. Circulation is our biggest thing. So when our hours were healthy, and we're going to be there again this year, we're close to 1 million, you can say that we are, divide that by 59,000, and you can look at that. Divide program attendance by that. Now, I will tell you that we are the second busiest library system in Connecticut based on circulation, and the branch is the busiest branch library even when the hours were reduced. This is a heavy reading, heavy using library community, and it has been for decades. At the Pequot, at ours, and there were actually 10 libraries. When I went back and did my history to figure out what's going on in libraries, this community has always been a heavy using library community. I don't think that's going to change.
Is that the commute to the city for a lot of people?
Maybe.
Thank you.
We've got time for one more question. We have 4 more departments to hear from, so Representative Lee. 2 more questions. Okay. 3 more questions.
Hi, good evening. Jason Lee, District 8. I actually have two kind of core questions. Talk about the circulation and the check out of books. How many people actually use the app to check out a book?
I don't know the number on that.
But you need your library card to use the app to check out a book, correct?
No, once you do it once you download it to your phone, you can use it.
But my library card...
Yes.
So can you separate how many people actually physically check out a book compared to how many people use the app to check out their book?
Never done that. Don't know if I can. It's a different type of software than we use for a computer catalog. I can ask our webmaster and see. I'm not sure yet about that.
And the second part, the teen librarian again, going back, you said that she, a lot of kids come to her and bond with her and she gives them advice and stuff. She's not a counselor though, right?
No, she's not.
So she's a librarian that says...
I had a bad day at school. Can you help me find a book? I'm dealing with an issue like this. A very friendly face. Nothing untoward, and very professional and very supportive.
Okay, thanks.
Bill Perugini, District 10. Thank you for your service to our town and
thank you.
the tour that you hosted a couple of months ago. It was very enlightening. Just to follow up on Representative Lee's comments, are there other opportunities for collaborations with the school librarians relative to serving the needs of the teens? It seems interesting to me that they're reaching out to your teen librarian and not utilizing the services at their schools.
Oh, they're using both. Remember, the library is open, the main library is open till 9, Monday through Thursday. The branch library is open till 8. It's just a matter of availability, and we're open on weekends. So, the same issues carry on beyond the school day, and we just happen to be there and available and trained to, service these kids. So it's not like we're not doing that. We do have collaborations with the school. If you came on the tour, do you remember the teen librarian said she went to visit, I don't know how many classes in one day, just a phenomenal amount. She is over there book talking quite a bit. We also, we collaborate with summer reading. The public library buys the books, but we collaborate with the teachers and the librarians ahead of time. If there's a theme, if there are concerns, if there are programs, we go into the schools well ahead of time and tell the kids, this is what we're doing this year, please come be part of it. So there's a collaboration definitely there.
But you feel they have greater access to your librarian than they do with their school librarians?
Oh, I don't think so. I don't know. That's not my bailiwick, but in the evenings and weekends, yes, I would assume so.
Thank you.
You're welcome.
Last question. Ellen?
Ellen Jacob, District 9. I also enjoyed the tour. Thank you.
You're welcome.
I had a question actually about something you mentioned, but that was mentioned on the tour, and that was that publishers coming out with new books or new products or new digital products are in touch with you, obviously, to try to sell some of their products, but do they donate and therefore add to your materials?
We like them to. We're always asking them to. Periodically, they do. What really happens is if people donate books to our libraries, maybe it happens at Pequot too, if the community does, and we all, both do book sales, those, we go through those. We comb through those donated books, and we actually replace those better-looking books with the ones that are on the shelf if they've been used too much. So we don't get an awful lot for publishers. We'll probably get more free trials for databases and digital platforms so we can see it before we purchase, which is a great service. But we don't tend to get an awful lot of books from them. They may donate to other libraries. We're in touch enough with them. I beg for things like that, but it doesn't necessarily happen. They've cut back too.
So they don't give you review copies or?
They give us advanced readers copies of some books, but not enough. And those things are not edited properly, and they're not, you can't put them on the shelves. They're a work in progress, so they're not good enough to be on our shelves yet. They're still editing them.
Okay, and the other question had to do with your first two lines, 51010 and 51030. So you've reduced your part-time?
Pardon me?
No, or it was reduced for you? Okay, so you lost one part-time request, and no?
No. What happened was, remember, we're now back to 2003 in full-time librarians or library staff, period. What happened was we reviewed our spending last year and the previous couple of years to see if there's any way of reducing the part-time budget, and we figured we can do a bit of that, and that's why that. So it's not one position, it's hours. It's not one position.
Okay, and then you had a 2.7% increase in the regular payroll. Was that just
That's just,
salary increase?
yeah, it's just
No.
salaries. I think what the town does is if they are anticipating a union contract agreement, that might be in there, but there's no additional full-time, sadly, in this budget.
Thank you.
If you recall a moment ago, I said this was the last question. This time I really mean it. Mike?
Thank you. Michael Hurley, District 1. I'll keep it brief. In terms of thinking about the library's budget over a multi-year basis, I think about circulation, programs, number of people walking through the door, number of checkouts, broadly speaking. What percentage of those visiting or checking out from the public library system are from out-of-towners?
I can't give you a percentage, I can give you a number, which you can figure the percentage out. I think it's between 30 and 31,000 are Fairfield Library card holders. Now that can represent more than one person in a family, because we know usually mothers hold cards for whole families, so we've got to remember that. So it doesn't mean
I hold the card for my children, and I'm a dad, so.
so you
just for the
understand,
record.
right? So it may not be just 31,000 individuals. It could be closer to several thousand more households. The 7,000 out-of-town residents?
7,000.
Yeah, about that.
And I guess I sort of wonder, and I have gotten inquiries about this in the past, about the town's advertising, the library's advertising program. And I mean, obviously, it's good to inform people who, reside within the town about all the wonderful services that you offer. You have a lot of great programs, a healthy public library system, indicative of a healthy community. I see these billboards, and my understanding is they're paid for, not out of your budget. It's, I guess,
No, they were donated.
They were donated, but
Right.
I see them advertised. There's one on sometimes I-95.
There was last year.
Yeah, but what is the purpose of trying to draw more people? I understand, I could see putting a billboard on Post Road by Mill Plain.
It's there right now.
Yeah, I get that. But I have a tough time understanding, and given how tight budgets are, and constituent ask us say, we love our library system,
Right.
we understand it's a public library system and that people are entitled to go there who live outside of the town. But do we really need to be advertising on I-95 to be drawing in people from other towns to the library system?
Okay, so it was an agreement that a Board of Library trustee went and talked to the business. They said they would do it for us, and I think it's actually I may have a different view on it, that it is actually advertising the community pride we should have in our Fairfield Public Libraries. We know a lot of people that are commuters who actually leave town and come back and would see that billboard, and they're Fairfield residents. And I'll also tell you, because our town is big enough, it's almost 60,000 population, we are a regional library and have been for a long, long time. So that really doesn't concern me. You know, and it was no money, no operating money. It was, and we didn't ever have any say in where those billboards were. We were just so lucky and happy that, you know, someone was proud of what we did. So we don't.
Yeah, no, I think it's great to advertise it. I think most people are very supportive of all the wonderful things that you do. I just, you know, sort of wonder why the billboards are in those locations.
We have no say where the I just said there we don't choose a location. It's in town right now, and I do know that the Pequot Library Director didn't mind it either. It's a source of community pride. It costs us no money. It's reminding people coming home, look at what you've got here. You've got this great library in your community. That's how I see it.
Okay, thank you.
Anything else? Any other questions?
Well, we'll see. Any comments from the public? Seeing none. I thank you so much for your time.
Thank you.
Parks and Recreations. Jerry, at last.
Good evening.
We have calendar integrity, but during budget season, that sometimes gets expanded.
That's all right. Our budgets start on the budget book, page 281. As you'll notice, our budgets are, we have Penfield, the waterfront, Parks and Recreation, which is really the administration, and the 2 golf courses. As you'll notice, as you go through our budgets, on the expense side, we have lowered 3 of the budgets have been lowered, and 2 have increased, minor percentage. These budgets are mainly seasonal, except for the Parks and Recreation one, which is the administration, which is our full-time staff that really oversees all the seasonal people in these other 3 budgets. I'll be happy to entertain any questions.
Representative McKenzie.
Jerry. Just 2 questions. One, on the revenue that you get, I'm sure, covers these increases.
Yeah.
Do you project a profit?
Yes. Our revenues are in the book also on page 42, 43, and 45, but I presented, and it's on the web page, the Parks and Recreation overall overview of the financials. And our total revenue projected for 15 is $3,995,538. Our expenses are $2,848,683. So we have a net income in the budget of $1,146,855.
Now, are you including bonding?
No, that is just expenses against the budget. That's strictly what's in the budget. The next line,
Can you give those numbers just one more time?
we're projecting in 2015, and I believe the budget was lowered. I didn't reduce it by what the Board of Finance did the other night by $8,000, I believe. $3,995,538 is the revenue projected. Our expenses projected is $2,848,683 for a net income expenses against revenue in the budget of $1,146,855. Now on the business side, okay, if you include, because the health insurance in all of our budgets were taken out, I include the health insurance of $269,670, bonding, which would be for the Penfield bonding and the golf course money that you people have been approving each year for us, of $318,869. And then our unemployment cost for our seasonal employees that do collect of about $40,135. And again, that's not an exact number because obviously it's projected. We anticipate about $518,181 net income business profit, if our numbers are correct.
So you net about zero.
We bring in $500,000 to the community.
Am I adding wrong?
Yeah.
I got, from the first
Unless
number,
I added wrong.
I got $1,147,000. Then health was $269,000, bond was $319,000, unemployment $518,000.
No, 40,000.
Oh, 40, okay. So $500,000.
Correct.
So, and is it possible to get more revenue?
It's always possible.
Logical.
That's a philosophical, and you know we're in a public recreation setting. We're always looking to lower our expenses and keep our revenues, our facilities breaking even or making money. Okay, some of our facilities are profit, such as golf, can be profit-making centers, and that's what we're working on. Penfield, the reason we're down a little bit there is because obviously we're not open, so we're less income there. Although we hope to be receiving a check to about $300,000 from the insurance company for loss of business, because we did have that insurance, and that would be a net. We had to reduce it by our expenses. They have agreed to that number. We're just waiting for the check to come in. That will go into the general fund. But I told the Board of Finance I do want to be credited for it.
Well, let me ask you differently.
We're always looking at the fees. I mean, we have to stay within the market of the programs in which we're trying to charge for. For instance, golf. Okay? When we raise our fees, we look at the area golf courses. Okay? Our competitors. The marina, the same thing. We look at that and where we stand. We will be reviewing that for the
marina, by the way, from the prices I've seen, is a steal.
Yeah, and I'm not going to disagree. And that's one thing. That's one area that we will be looking at this coming fall. Okay, for next year allotment, but. We are always looking, and what we'll do is we'll look at the market and look how to do that, and that's how we will come up with our fees.
Thank you.
Representative Bergwini.
Yeah, Bill Perugini, District 10. I know there's lots of folks who come from all over the state to utilize the beaches to ride their horses. Do you think there's any opportunities for collecting revenue, limiting access and collecting revenue for them to utilize our wonderful shoreline to ride their horses?
That's somewhat hard to, the answer is yes, because we have discussed it. It's problematic because how do we control it, okay? During the winter months, we're not down there. So that means I'd have to put someone down there to do it. And they don't come every day or every day at a certain time. So we did think of it. For the amount of horses, and on a nice day, you may see a lot more than on a cold day. We did discuss it, and we just didn't think it was a practical, and you're not going to bring in significant revenue to do something like that. We did increase our revenues for summertime beach stickers for daily parking. We went from 25, we went with some of the Westport and a few other communities. They charged, because we were getting inundated with out of state and vehicles. So we went from $25 to $50 on weekends, and from 20 to 25 during the week.
Representative Bateson?
Thank you, Ed Bates in District 3. I want to follow up on Representative McKenzie's comments. I agree 100%, Jerry. For the past several years, every time you've come before the RTM, I'm a firm believer that there's a lot of room to move up on the fees. And every year I ask you, Parks and Rec Commission, to please consider that. You are not only well within the marketplace, you're below the marketplace on a lot of programs. I mean, in my family, we do a lot of external, longshore. I guess you discontinued the sailing program down here this summer.
Right.
Now we're doing longshore. I mean, you guys were, 30 cents on the dollar what longshore is charging. Tennis down at the rec center, I mean, I'm paying virtually nothing at, veterans for the town program. Down at the rec center, it's 3 times the cost. I see nothing wrong with operating this as a profit center, and I see that you are doing that. And when it comes to the Parks and Recs, those programs fees, to increase that revolving fund, I mean, that is, I saw what you're doing with that money this year. That's a good thing. If we generate extra money, we can reinvest it in our infrastructure in the Parks and Recs, repaving your courts, whatever you need to do. Don't be afraid to go to the Parks and Recs and say, we got to move up. There's nothing wrong with generating a profit on these programs. We're using them. Honestly, I don't mind paying for them. Thank you.
And I thank you for those comments. I just want to clarify one thing, okay? The programs that you're speaking of are all in the revolving. They're not in the general fund budget. The only things that are in the general fund budget, okay, are the marina, Penfield, and golf.
I'm fully aware of how the
Okay,
revolving fund works. The revolving fund, that money, excess money, if it goes above a certain amount, I realize Board of Finance can take it out. But also, too, I see what you do with that money, and you reinvest it in the infrastructure. You're taking money, repaving tennis courts. Those are good things. It takes money off the table for Public Works that has to do that.
Right.
So there's nothing wrong with increasing those profits. Thank you.
Thank you.
Representative Lee?
Can I follow up on that? On that same point?
Representative Lee has no objection. No problem.
I've heard that raised frequently over the years about the fees and the RTM asking for higher fees. I know you've done some of that. That's under the jurisdiction ultimately of the commission to set those fees?
Yes.
How do we get that message to them? Do we need to go as RTM members and tell them we are looking for them to seriously consider raising their fees? Do we need to be more of a presence and explain that and press them on that? I mean, I too have young children who are using the camps and the programs that you offer. They're phenomenal. I'm a single mom. I'm not looking to spend more money, but you are not charging me enough money. I'm paying 3 times the amount of money for soccer in a private program than you are at your rec program. There's got to be some wiggle room to come up.
We are going to be increasing, we are projecting an increase in some of our programs for next year in that, because we do, my staff and I are looking, just what was mentioned earlier, to enhance some of our infrastructure, rather like we've done before. When we did the turf field several years ago at Tomlinson, we were able to contribute a couple $100,000 towards that, and the town bonded a couple $100,000, and that's how we got that project through. We are looking at increasing, not every program. What we do is we outsource a lot of our programs, such as the tennis, okay, lessons. We were doing the same thing, a lot of our indoor programs, our yoga for the kids and things like that. So we are looking to increase those rates, okay, for twofold. A, as you see in the revenues, we're projecting $50,000 to go to the general fund, okay, as well as hopefully having a balance there to fix some of the infrastructure in the park system. So we are looking to do that. And I appreciate the comments, because a lot of times we raise the rates and not everybody is willing to pay. You know, you go up $1 in golf and it's tough, okay? And I understand, but we don't, some of our expenses, I'll take soccer, okay? The travel soccer program, they pay for, you know, training indoors, they rent space, things like that, they rent the schools, things like that. We have expenses, but not to the tune of a $300 a year season. I mean, baseball programs, I say it all the time, to play baseball, they're paying $1,100 or more to play baseball this year in some of the AAU programs, okay? We are a municipal recreation program where we try to have a program that youngsters, okay, can start off in, okay, at a reasonable fee, okay, and then grow on. If you want to be a star in soccer, go to travel soccer. If you want to do lacrosse, go to lacrosse. So I understand where everybody's coming from, but, and I'll appreciate the time when we do raise the rates and the people start calling. I'll refer them to you.
Thanks. Jason Lee, District 8. I want to also go on the same side as my fellow representatives that, you know, especially golf. I love the golf. I think you guys do a great job with especially all the rounds you have. I think we have to make people realize, you know, when you're the top par 3 in the state of Connecticut, it says a lot. But it also says that people will come and play. And especially at Smith Richardson on Mondays, I like to see those rates go up because it's the only game in town that's not a private club. And private clubs around this area are closed on Monday, and they would generally come up. I think there's a huge market for that. And when I hear you say, oh, people complain, they won't complain because the facilities warrant that. And I think that's something we need to look at. Same thing with the beaches. You know, we charge $50, but some towns not only charge $50, but they charge per person in the car. Right. And I think that would be something phenomenal too, because in all reality, it puts a lot of strain on the resources you have if you have more people. If these people don't want to come, it could be less resources taken away and better preservation in the long run on all fronts.
One of our biggest areas, and I appreciate the feedback, one of the biggest areas that we can generate revenue, okay, is our biggest revenue maker, is the beach sticker program. Okay? We're charging you $20 for the year, which gives you access to 5 beaches, okay, and the dump. Okay? I mean, we could certainly raise that if you're looking for revenue. But you're going to get the feedback that that's why we pay taxes, that's why we moved to Fairfield. We have the beaches, we should have entitlement to use them. And people aren't going to, you know, just look at the number of what the revenue is on the beach sticker program. So there's room to raise. If you're looking for revenue, those are the areas that, you know, rather than hitting the little programs, it's the one program where you had the biggest volume. And that would be, but we'd get a lot of feedback from that. So just wanted to share that with you.
Representative Palmer.
Hi, Jerry. Joe Palmer, District 4. So you have several big things going on right now in town. You have the tennis center is being redone. Does that represent any type of new revenue opportunity?
Yes. That's what we're planning on, moving a lot of our little programs. And I hope to be able to have a tour of that probably at the end of May, maybe June, to share it, because that's when we hope to have it open. But yes.
Is that reflected in this budget?
No.
Revenue from that? Okay.
But it wouldn't be in the general fund budget. It would be in my revolving budget.
Okay.
Okay? Because of the fact that that's where I run the programs out of. Okay? And I might hire you as the yoga instructor, and I'd get 20 or 25%, whatever we worked out, okay, for you to run the program. And and then whatever cost I had in there. So, but we're also got our teen center is going to be there. I mean, it's going to be a beautiful facility. So, yes, the answer to your question is that is one area that we're looking to program more. Because
Please don't hire Joe for yoga, please.
Yeah, I only, it's 80-20, by the way, for me. Are we talking about maybe $10,000 a year in revenue?
I don't even want
Ballpark,
to,
okay.
I'm not going to put a number out there because we don't know how we're going to program it yet.
But that'll be done in May.
The building, the building, they're hoping to have done in May.
Okay.
Okay, then they, we still have landscaping and parking.
Sure.
The whole project will be done, the entire project with the new tennis court will be done by the end of August. Okay? Because they still have to knock down the little tennis building that's there now, build another tennis court. But they're hoping to move everything over in this month if they get a temporary CO.
Okay. And then in terms of the out-of-town beach stickers, that's gone from $25 to $50. Is that like a weekend pass?
Yes.
Okay,
No, it's just daily parking.
Daily parking, okay.
On the weekend, Saturday and Sunday and holidays.
Do you anticipate that to, because I think that's actually a great place for revenue. It's to be able to charge people from outside the town who want to utilize our services. You probably get all the complaints about, there's so many out-of-towners in this, on the beach, it's packed, I have no space, blah, blah, blah. But, that's a great opportunity. And then on the golf course, as Jason was saying, the out-of-towners creates.
Well, the golf course is, like I say, is a little different because we do a market, okay? And I'm telling you, golfers will go where it's least expensive to play on a good course, okay? I mean, if they have the opportunity to go to Trumbull, okay? Our competitors are Longshore, Trumbull, Sterling Farms, okay, in this area. Fairchild Wheeler, the Black Course, okay? But they have to keep their rates low because they have 36 holes of golf that they got to try to fill to make the numbers work.
Right.
So.
And then
And our infrastructure, I mean, what you're putting in each year, $100,000 of bonding. We're looking to come and do the infrastructure, hopefully this year, for the clubhouse, which needs to be done, and we're talking, as you know, in the 10-year plan, between $2.5 and $3 million for that project of the parking lot. I mean, so we are investing back into the infrastructure and still trying to carry a profit back to the community.
And that was my next question. During the capital, non-recurring capital budget process or item process, that was on the waterfall
Right.
as being something that we would would be coming up. So you're saying that in this year,
Yes.
we will be seeing a proposal from you, around the $3 million mark?
Approximately, yes.
Okay. So
We're going to be asking for a building committee to be formed to investigate what needs to be done and move forward on it.
are you,
Because
Right.
the
Yeah.
reason I'm saying that is we have an infrastructure up there that needs work, from furnaces, air conditioning ducts, et cetera. And I don't want to go and put those infrastructure items into the building, okay, if we're going to renovate the building. We have windows that are original windows, so when we turn that heat or air conditioning on, it's just going out. So we're hoping to make this a green facility. Solar, it'd be a great place for solar. I mean, we're hoping to not only invest into new infrastructure, but hopefully reduce our expenses in the overall picture. So,
right, but that, I know there's also, when I was saying before that you've got a lot going on, another trend is that you privatize some of your maintenance crew. And I don't want to go down that path, but last year you also were looking into privatizing the management of the courses. Is an idea on the table at all of maybe finding a private company that wants to make a long-term investment in the clubhouse where it can really offset some of our expenses,
No,
like the tennis center?
No, we didn't look at that deeply, okay, because there's not a lot of maintenance companies that are going to invest into the clubhouse, okay? Not if you're looking for return on our investment. We did do an analysis. It is on the golf webpage, I believe. We looked at different scenarios, maintenance only. And one area that we're looking at and we're negotiating is reducing the workforce of ours and still keep it internally. So instead of having 5 employees up there, have 3 full-time employees and supplement it with seasonal employees. That's one area that we're looking at. The other area is to outsource it. But everything right now is being negotiated, and we're looking at it, and we are moving forward on it.
Right. I would just like to see us look into, and I know you've got an entrepreneurial mindset, and I just would like to see us partner with someone for the catering aspect of the clubhouse. You have a great tenant there right now that, you know, might be someone that would be interested in having a very long-term relationship with the town, and that could really help us offset expenses. I would also argue that, you know, we should be looking at the same thing at Penfield, you know, someone who from the private sector that wants to, you know, have a long-term contract. I think the tennis center was a great win for us. You know, I think we had a $40,000 expenditure to knock that building down, and that was it. But we get a new building now. Look to see other.
We are going to be exploring that with the golf course in the sense that we're going to see once we get the building committee, that might be one of the steps they look at, is saying, you know, what if we had an entrepreneur come in and operate this?
Okay, it's great that it's on the table.
Yeah.
Thanks, Jerry.
Jerry, I've got a question. With regard to Penfield, and there's a reduction, 7% in seasonal payroll. Should I ask, should I be surprised that that reduction is not greater than it is, just given the, presumably the projected hours, man hours needed for Penfield this summer?
Yeah, well, it is reduced, it's down to 59,000 right now.
Right.
Because they reduced it by 8,000 the other evening. In other words, the total budget, not, but it really came out of payroll. Okay? So that was reduced by $8,000.
Okay, so
the other
that
evening.
payroll line is,
Right.
just by itself is reduced 8,000.
Correct.
Okay.
The reason we did that, when I obviously put the budget back together in, starting in October, I had anticipate, like I did last year, that the building would be open in January. The building committee is still working on it, and I don't foresee it being open until possibly June of next year, the earliest. And so when I reduced the numbers, so basically all the numbers that you see in here, the expenditures and everything, are for Penfield 2.
All right. Okay, so exclusively Penfield, too.
Mm-hmm.
All right. Any other questions? All right, I would go to the public, but you seem to have outlasted the public tonight, Jerry, so.
All my friends.
They just couldn't last with you. All right. And Representative Lee has advised me UConn's up 20, so it's both teams.
I would love to see the marine fees. I mean, that's a giveaway. That's something else that could really probably go up also.
We just,
You just
to
did.
be honest, we just discussed it this morning.
No more
That's-
discussing. We have to do it.
Well, I know, but we did. We just discussed it this morning. It's easy for you, but the 600 voters are going to be upset.
Do I hear a motion? All in favor? Jerry,
I got a
thanks so
picture, you
much.
didn't ask.
Jerry, don't leave before I can thank you.